Oh, okay. Okay. Doug is not here. Is he there? Okay, yep. So we will go ahead and start our study session. And who's gonna lead that?
Good
Yes.
evening.
Okay. I was like, where is she? I know she's here somewhere.
There's a lot of us now. Good evening, Mayor and members of City Council. This study session is a health insurance review tonight, primarily our city medical plans. To begin with, just general information on those medical plans. There are 3 plans that we offer, 2 HMO copay plans and 1 high deductible health savings plan. Those 3 plans fall under a fully insured structure within the financial risk and how claims are paid on the back end. And then the city has been with Kaiser Permanente as our main carrier for almost 40 years. So because we've been with Kaiser for 40 years and with relatively the same medical plans over those last 40 years, they've changed as the insurance industry has changed. But we thought an introduction into these aspects of the moving pieces of our medical plans. This would be a good time given 40 years, we've seen a lot of change. Globally with the pandemic that affected the insurance industry, the implementation federally of the Affordable Care Act almost 10 years ago, and then recently, regionally, our state legislature changed the definition of large employer. So we anticipate this affecting our insurance renewals going forward. Last year, we were considered a small group employer. This year, we are considered a large group. The main parts that we're introducing tonight are areas that the city could potentially spend more study sessions diving into these different aspects. So Kaiser Permanente offers 30 plus medical plans. Obviously, another option would be to look at a different carrier going further into that dive. Looking at the financial risk and the claim structure, these are how the medical plans are structured behind the scenes. So our team here from Gallagher, they will be presenting those more technical aspects. And then looking at the city's premium share structure, mostly through the lens of looking at what other towns and cities are doing.
Catherine,
Yes.
can I
Please.
just add something? So part of the reason we're even bringing this to council is that historically the city has covered all increases. The employees have not necessarily had to contribute to that. And it's obviously a big perk that we get to give our employees, and I believe it certainly helps with retention. Realistically, a lot of local jurisdictions do not do that, and they share those increases with their employees. For the reason we're bringing this to you now is we need to start thinking long-term about what our strategy is going to be. I don't think that we should keep just approving it without talking about it and without thinking about what the options are. So this is really a long-term conversation. This is not something that we're putting in front of you tonight for us to make decisions in the next 3 months or 2 months. This is really looking at the long-term financial health of the city and wanting to make sure that we still keep employees, their benefits package very healthy, but at the same time, balancing that with our long-term financial picture. So the reviewing the structure of the city's premium shares is a good window into why we as staff are kind of putting this in front of you now.
And since you bring it up, I just want to ask, and then maybe as you go through it, you can keep this in mind and maybe address it, because in the fact that we were always picking those up might be the reason, because one of the things I looked into was and I don't even know what this is, you probably do. The KFF Employees Health Benefits Survey, which I don't even know what that is. Okay, good. And it talked about that even for governments, private employers oftentimes have the employees pay more than governments do. But in governments, it's typically anywhere from 10 to 15% for the employee and then 15 to 25% for family. And we're sitting at 6 and 9 and 2 and 5. And which seems, and again, I imagine that KFF is probably nationwide, maybe it's not Colorado, but maybe it's also then because of we kept picking up those increases that maybe that's what pushed it down. I don't know, but that's one of the things that I noticed. You made that comment. Maybe you can kind of talk about that as you go through and just say kind of how did, and maybe the answer is, yeah, the KFF survey is BS. I don't know, but that's just what it says, and it just seems like it is a reasonable thing to ask about, right? I mean,
Sure. I think, and these ladies will confirm, there are many different ways to benchmark, especially when you're looking nationally. Do you slice it private sector, public sector? Then when you get to public sector, Gallagher, they represent school districts, which are much larger than us. The state of Colorado, there's so many, that is why we are introducing this topic, is because there are so many ways to dive into all the different aspects of how decisions should be made going forward, and what strategically makes the most sense for the city. I don't know if that answered your question, but we'll dive into the renewals past and some different ways to. Okay, so as we mentioned, there are 3 plans. Most of our employees participate in the Platinum plan. Down below in the blue are those premium shares that I believe Earl was just speaking to. So the city does contribute anywhere from 91 to 100%. With a high deductible plan, I believe, and they can confirm better than I, that high deductible plans are typically covered at 100%. That is to drive participation into that plan. Obviously, when you slice our population, that's not really happening with our employees. And then this is just a breakdown of information that I received from other towns and cities. So 92% do offer multiple plans. There are cities like Lafayette, Greenwood, they do only offer one. So something to think about, another way to think about how to offer medical plans. 40, almost half, about 46, do offer 3 or more. Aurora, obviously a much larger city, they offer 7 medical plans. And then about half do partner with Kaiser. That's not to say, depending on population size, with our group plans, we have been in those plans for a long time. So Kaiser and Aetna, now they allow you to offer 2 different carriers. Our plans don't currently offer that because we have carried them for so long, but those are some strategies that other towns and cities can provide because they're a larger group, larger population. So looking at the premium shares, there's a range of how towns and cities will structure premium shares. This is just the range that I saw from all the ones that responded. There's anywhere from 65% to 100% covered. Greenwood, I believe, covers 84% to 90%. So just to give you an idea, 65 to 100% is not the standard. There's multiple different ways that folks do that within their own organizations. And then the renewal philosophies. Again, there's many different ways in between these two, but these were the 2 most held renewal philosophies with towns and cities. So a balanced cost-sharing approach. which is dependent upon knowing that increased renewal and their budgetary constraints. So this first renewal philosophy is more of what I'll call a game time decision. So they get the renewal, it's 5%. That town or city decides, okay, depending on everything else we're trying to do with the budget for 2027, the city will take on that 5%. However, when you get to a 20% increase, that's when they start to look at, okay, we can't take on 20% as a city. We'll split this somehow between the employees and the city. The other philosophy that I saw is more of a standardized approach where they have set premiums of 80, 85%, 90, 95. The renewal comes in and the primary goal is to keep that 80, 85, 90, 95 structure. And then again, we did see, Chris is correct, I think our city has primarily taken a lead approach in the benefits, absorbing those increases. We are not the only one to do that, but it is a lead approach. So it's not common that that happens with towns and cities. And then just a quick review of what our insurance renewals have looked like over the last 5 years. I looked back 10 and 12. We did have negative renewals in 2016 and 2017, and that had a lot to do with implementing the Affordable Care Act. I won't go into the details because it does get very into the weeds of age ratings, composite ratings, and how they defined a large employer federally, and then the state at that time had defined a small employer as under 100, but that's no longer the case with the state. If you all are ready, I'd like to introduce our insurance brokers that are here to go over the more technical aspects. They're from Arthur J. Gallagher, and I will let them introduce themselves.
Yes, thank you so much.
Thanks, Catherine. Thanks all for having us. We appreciate being here. I'm supported Sarah Darley. I'm a benefits consultant with Gallagher here out of our Denver office. I've been with Gallagher for just over 7.5 years. I'm a 6th-generation Colorado native. And I'm joined here by my team, Melissa and Andrew, who help support our work here with the city. Before we get into the more technical aspects of our conversation here today and how the medical plan is funded, what questions, comments, concerns can we answer based on what Catherine's already shared? I'm happy to speak more to things like benchmarking results, what other towns and cities we work with are currently doing in this environment. Open forum before we get into the rest of this.
Are there any specific questions? I think Councilor Holland expressed my question, which was, obviously the city's in a very strong financial position right now, and so I don't want any of our staff or employees to get the impression that that we're making this change out of sort of dire financial circumstances. However, that being said, we did do a very comprehensive compensation study, and we adjusted people and based on that information, and so I think that in that same vein, it's reasonable to do a similar type analysis of our benefits package and make those same adjustments. When we first started this conversation months ago, when I learned that the city has absorbed increases, that is remarkable to me. I don't know that I've ever heard of that happening in the private sector. And then the percentage that we fund of family coverage is also very surprising to me. And, we do want to offer nice benefits. But so I think specifically focusing in on where the norms are around the percentage share that people pay and try what would be a way of resetting that without doing some major, I don't want anybody to get a giant increase at the end of the day either. So I'm very sensitive to that. Anyway.
Absolutely. It's a great question.
I do, and I think I should have said that when I asked that question too, because here we are as council and we're sitting here with staff, and I think everybody, we think we have the best staff in Colorado. that deserves everything they get. Right from way back in 2014, when I said, we got to get rid of that crappy hellhole that they're in because our employees deserve better and we built this place. I mean, we're always striving to do that. At the same time, there is the balance that we're always looking at with regard to saying, what do we do, recognizing that we're stewards of the taxpayers' dollars. And so there's always got to be a balance and looking at all of these sides to make sure that there's reasonableness going on all the way. So that's an important point, I think, to go with what the mayor is saying, and hope everybody gets that, so.
Yes, yeah, the stewardship piece is certainly an important one, right? You all sitting here in this room have a fiduciary obligation to not only your taxpayers, but also to your employees, right? And we have no concerns about you meeting those fiduciary obligations, but that's why it's important that we have these conversations.
If I could, sorry, Counselor Robinson, who's joining us remotely, has his, I see you down there, Doug.
Yes, can you hear me okay?
Yes, we can.
Can you hear me okay?
Yes. Can you hear us?
Okay, great. Yeah, I have a question. So I'm in the investments business, and we have several companies we have investments in actually participate through a PEO plan where they aggregate the purchasing power of several smaller companies in order to get better negotiating leverage and rates with the carriers. And that's been successful at reducing our overall healthcare insurance costs pretty significantly. I know it's that same structure is probably not the same in or available in government, but are there similar group purchasing options for government and entities that we might consider as part of this review?
It's a great question, and I'll start there, and then we'll bring it back to our breakdown of medical premiums. Yes, there are similar purchasing vehicles available to public sector entities. Specifically, they're referred to as trusts and pooled type products. There are two that exist in Colorado currently. What I can share is that we frequently bring organizations out of those pools in this day and age, like most frequently due to unpredictable renewal increases. As we look back at the city's renewal history over the last 12 years, across Gallagher's book of business as a whole, inclusive of the private sector, groups on average have seen about 13 to 17% increases, depending on how we segment that. In the public sector, it's slightly lower at about 12%. But you at the city, right, we're looking at single-digit numbers, which is a rarity in today's landscape. So yes, those consortiums do exist. Yes, we'd be happy to help evaluate if one of those would make sense at some point. However, given the experience that you currently have in your health plan, you've got a relatively healthy population. Kaiser has viewed your risk pretty favorably. I don't necessarily view it as something that would provide an economy of scale. Rather, you would be a healthy population subsidizing more unhealthy populations in a pooled environment. Does that help answer your question?
Yeah, that's very helpful. Yes, they're available, but it's probably not something we could take advantage of that would help us reduce the overall costs. Thank you.
Yeah, probably not right now. Not to say it won't change, right? Catherine, if I wouldn't mind bringing us back to the breakdown of the three medical plan slides, one of the items I'd like to call out on this that I think is, and happy to include this in our follow-up, but when we look at the total value of a plan, one of the areas that we do see opportunity for improvement, and the way your employees are likely viewing this, is you're subsidizing the most expensive plan at 94% for employee-only coverage, and we have 69% participation. The total out-of-pocket cost to an employee when we take into account their premium expenses alongside their total out-of-pocket maximum for the year is $3,300. When we take into account our gold plan, that number is $7,500 for employee-only coverage, and for our high-deductible health plan, that is $4,500. So anyone that's putting together the math here, given our current structure, can very clearly say in a worst-case scenario, assuming I hit my out-of-pocket maximum for the year, I'm only out $3,300 on that most expensive plan, and we're subsidizing it very heavily. So on our coming slides, we'll talk about other ways we can potentially fund the medical plan, but we see this as a very easy opportunity to either change the contribution structure, change the plan design, or ideally do some of both to right-size this so that when employees go to do this math, it's in alignment with your contribution philosophy here. To speak a little bit more on the benchmarking on our next slide and to kind of echo what Catherine has already shared here, we work with a lot of public sector entities, school districts, cities, towns, counties, and a lot of them are subsidizing the least expensive plan at 100%, right? When we look at the total compensation philosophy of a public sector entity, right? We can all likely agree that base pay is probably not as high as the private sector, but this is part of the reason why. Really, really rich benefits. So from a subsidy perspective, I don't view the 100% as the problem, rather that we are subsidizing our far more expensive health plans at a much higher clip. I think that's where we've got opportunity. But to speak to the question too on like the Kaiser Family Foundation survey, we're also happy to share benchmarking that's a little bit more specific, as Catherine's done, to those public sector entities we work with here in your backyard that you're likely competing for talent with, because that's, I would imagine, more meaningful than Mississippi or New York, if you will. Yeah. So to talk a little bit further on the funding and cost control spectrum. So as Catherine mentioned, and what is mentioned here in the memorandum, our current Kaiser health plan is considered a fully insured health plan. Anyone familiar with this terminology? Wonderful. So fully insured is exactly what you think of when you think of an insurance policy. You pay a set monthly premium for a plan for a 12-month policy period, right? Our plan renews on January 1st. In exchange, you have passed all fiduciary liability, everything you expect an insurer to do for you and your employees, and you've passed that on to Kaiser, right? We know if we have someone who enrolls in any of our plans, we know what the monthly costs will be. We know how to remit premiums and all of the responsibility for administering their claims, directing them to doctors, making sure that your employees are satisfied with their health care. That lies with Kaiser. So that's a fully insured arrangement, and that is what we are currently in. Now, there are other ways to fund our health plan, as you can see here. The red arrow indicates where we are, and one of the items that we're prepared to discuss here today, but also in further depth in a future study session, is level funding, which is further up the cost control spectrum. Level funding is a form of self-funding. We typically call it partial self-funding, and level funding was actually pioneered by an insurer called Great West, as you may remember them. They're now Cigna Healthcare, and it was pioneered here in the Colorado market. So the complexity and number of employers who offer level funding in Colorado is actually very high, and we see employers down to 20 employees using this methodology in the hopes of providing cost savings. So that's what we'll talk about a little bit here on our next couple of slides. To give just a really brief overview to level funding, which falls in the middle column of the table that you see here on the screen, level funding still provides you the ability for predictable monthly costs. In a true self-funded environment, you as an employer pick up any and all claims costs up to certain thresholds, and that number every month can vary very significantly. Level funding, we call it self-funding light, because you still have those predictable monthly premiums. You know exactly what's coming out of the bank account on a monthly basis. The only reason that number ever changes is due to changes in headcount. Now, why so many employers are evaluating level funding is in your current arrangement, if your plan runs well, let's say we've paid Kaiser $1 million in premiums for the year, and Kaiser only pays out $500,000 in claims, they've got another $100,000 in administrative costs, Kaiser recognizes a premium of $400,000. Now, Kaiser's in an interesting position in that they are a nonprofit here in Colorado, so their ability to take that profit and actually call it a profit is, as one can assume, pretty limited. However, those funds have been given to Kaiser. We may see a renewal decrease, but they're not returned to us as an organization. In a level-funded environment, there is a mechanism called a surplus share, which allows you as the employer to receive a portion of any surplus premiums, specifically claims dollars, back in the following plan year. Now, one of the reasons that this we think might be of interest is, one, we ensure that those dollars are coming back to the city, right, stewarding our taxpayers' dollars appropriately. But two, as we look at your renewal history, right, it's fair to assume, based on our prior renewals, that the plan has run pretty well, right? When we look at that 10-year renewal average at 6%, that's pretty indicative to us that we think the plan experience is running at least all right. So the chances of us receiving a surplus back is a little bit higher. The other nice thing about level funding as opposed to a true self-funded arrangement is that if our claims are higher than expected, right, if we're not running in a surplus position, that deficit does not carry forward, and the city is not responsible for it if you were to leave the arrangement with Kaiser and make a change in carrier. So you kind of start from scratch every year unless you're running in a surplus. Now, if you're running in a deficit, we can expect that renewal increase to be higher, right, to account for it, but it is not that excess funds will be due at the end of the plan year. The last couple pieces I'll touch on here is plan design. With certain level funded carriers, there is much more flexibility in plan design. With Kaiser, we are still choosing from a set portfolio of plans. When I say plan design, I'm referring to things like deductibles, co-pays, co-insurance. Those items are all preset for us in a portfolio. We don't have the ability to toggle individual aspects of a plan design. But again, Kaiser does provide us with 30 plus options to choose from every year. So we do still have some choice there. And then we also receive increased access to data and reporting. So in our current arrangement, we do not have any insight into how the plan is running, aside from what we can infer from the renewal increase at the end of the year. So with data and reporting, we're able to say, here's the surplus that we're running in or the deficit, and we do get a little bit of information as to why, right? We have a high cost claimant with XYZ diagnosis. That's about all the information that we receive, but it does give us some of that insight, which is nice. And then lastly, level funded plans are exempt from state insurance regulations and taxes. So as Colorado continues to legislate in the employee benefits space, specific to things like fertility benefits, coverage of GLP-1 medications, you as a level funded employer have the ability to opt in or out of those types of regulations because the only regulations you are subject to are federal. So that is level funding versus fully insured in a nutshell. A lot of information. What questions can I answer?
Well, and you didn't cover self-funded, and I don't think that is something that would be really applicable to us, right? So no need to delve into that.
Happy to if you'd like me to. I would not recommend it at your size.
Mayor, may I?
Yeah.
A quick question. In terms of level funded, is there ever any experience where because of an attempt to do cost containment or earn more of a surplus back, that there is evidence of any employer kind of pressure towards trying to decrease use or claims?
Great question. And no, there's not, because you as the employer are still handing the ability to manage your claims and cost contain them as you would in your current arrangement. That still exists in a level funding arrangement. So Kaiser is still acting as what we call your claims administrator. So they're still the ones determining who can and cannot get care, what claims are and are not approved. You as the employer do not have any purview over that. I would say like the exception to this is like we do have employers who say I would like to be level funded, and we're going to put in place a virtual direct primary care option for our employees with the hope that they use that instead of going to the doctor, which costs more, right? So they're providing different avenues of care, not no avenues of care. So those are conversations we definitely do have in the attempt to lower claims costs, but nothing from a discriminatory nature, if you will.
Thank you. And then the second question that follows from that is a little bit of, when you mentioned that there is some ability to be a little bit more transparent, I assume that means that you're able to say your April was higher because maybe these 6 events or these 6 claims. So it requires employees to be sharing access to the types of claims that were made or agreeing that the data that they are using or making claims on is shareable within the database. So, I mean, it sounds to me like there's a little question about whether or not you have as much privacy about your information. I understand it's probably going to be scrubbed from identification, but still, in an entity that's small, that probably is not very easy to keep hidden.
It's a great question. So the data that's received is first received by myself and our team. And then how we choose to share it is decided by a set of practices that we establish together. So typically we come up with, whether it's everybody in this room and we're all going to go through HIPAA training together. It's really fun and riveting. That's who we're sharing it with. We do not recommend typically sharing this data, however, in a public forum, because these types of conversations, right, are open to the public. And you're right, you do have a small population, so it's easy to identify if someone's been out of work for the last 4 weeks and we've got a high cost claim, right? Sometimes those comparisons can be drawn. So typically what we recommend is HR, someone from finance, typically a city manager joins in that conversation. If you all would like to be part of it in a manner that can be held privately, that's typically what we choose to do with that data. But it is not publicly available to your employees unless you were to make it so.
And I guess out of curiosity, why would we want that data?
Great question.
Yeah, I mean, why do I care really if the claims are what the claims are? Why do I care if 1 month is higher than another month?
Great question. So some employers don't care. They're in your similar position where claims costs are claims costs, and you don't have aspirations of becoming truly self-funded. Some employers do care because some of the data that we receive on occasion is, oh, how many people went to the emergency room? If we see that 12% of your population is going to the emergency room as opposed to a doctor, that gives us the opportunity to know that some education is needed, right? The emergency room is going to cost you more than a doctor's visit. So how do we make sure people know to go to the doctor? So that's the kind of actionable insights we get from the data, but not every employer wants that, and that's perfectly okay. I'll say a lot of it is just nice to knows. It's not something we can often do much with in a level funded arrangement.
And I'll just jump in for 2 seconds. One, I think Doug has some questions.
Oh,
Yeah,
sorry.
but let me just, as Catherine and I and the team have started thinking about some long-term implications with the fully funded or fully insured that we have now, I mean, we get no information, and it's hard to know if we're right-sizing some of our approaches, right? Because we just don't get any information back. You get your renewal, and you can infer, but it's sometimes it would be nicer for decision-making, not because we're trying to zero in on an individual or anything like that. It's more a matter of how can we be as surgical, and no pun intended, and as strategic as possible with our approach. So there's been times where I would have found it to be very helpful. So.
Okay. Counselor Robinson.
Yes, you mentioned previously that our employee population is healthier than most, and that totally makes sense to me because the majority of our employees are police officers who are, in essence, required to work out almost every day. So I am interested in your thoughts about how that plays into your recommendations here, that we do have a healthier employee population, or likely to have that continuing going forward. Is that a big part of your recommendation in terms of the level funded?
It potentially is, yes. And without doing a little bit more data analysis, I don't feel comfortable standing here today saying that level funding is the path that we should do moving forward, right? I do think it is something that we should probably explore a little bit more thoroughly. But yes, that is one of the reasons. If we'd received double-digit renewal increases from Kaiser over the last 5 to 10 years, my recommendation would not be that we have this conversation here today. Simply because the likelihood that we end up in a surplus is pretty low when you have an unhealthy population. But in order to evaluate the risk, we do have a couple of tools that we can use. One of them is an AI underwriting tool that scrubs pharmacy data. It's how carriers themselves actually look at underwriting risk when we don't have claims data. So that's one of the tools that we can use to kind of do a preliminary analysis. It comes back to us with a risk score. That helps us evaluate whether level funding is something that we should evaluate further. And then, of course, Kaiser's underwriting itself is very telling. They know our claims data because they are our incumbent carrier. So if they come back and say that our level funded premiums are 10% higher than what we're currently paying, they're seeing something that we clearly don't have insight into. So based on what we know, yes, I would say that healthy population, a good candidate for level funding, but we'll know more when we dig in.
And if we, in cases with level funded plans where they do get surplus refunds, where does that money go? Does it just go back into the general fund? Is it refunded to the employees as well? Is it, how does that, I mean, I'm sure it depends, but how do most people do it?
Yeah, great question. So the accounting problem posed by this is one that every carrier is aware of. And so what typically happens is claims are paid typically 6 to 8 weeks after the time they are incurred. So when the plan year closes on December 31st, and we start a new plan year on January 1st, the carrier is still paying claims from the end of December through February. And so what level funded carriers do is if you are owed a surplus, they square that surplus up typically in the third month. In your case would be in March, we would be notified of what that surplus is. And then they actually use it to offset your administrative expenses. So not your claims expenses, but your administrative expenses in the fourth month of the following plan year. So in your case, April. So basically what it does is it reduces your premiums down. And what we choose to do with that is there's a couple of ways. We can give employees a premium holiday. We can lower their premiums for a paycheck. You as the employer can truly just recognize it as a cost of doing business and pay the invoice as you normally would and move on your merry way. So a couple of different ways to approach it, but it is not returned in the form of a check. It goes back on the invoice. Yeah.
So in theory, I mean, that's kind of like a general fund refund because it goes into our account and what we choose to do with it from there is, I mean, it doesn't go into, it doesn't come out of our account.
Yeah.
Well, it is split with parks because of our parks employees.
Right,
So-
okay, but, yeah, okay.
Yeah. You'll recognize it wherever benefits are being drawn from. Yeah. Yes. So as
Other
we
questions? Anybody have other questions?
Yeah, our next slide here is just a really quick graphic, right? And this speaks well to your question, Mayor Brown, that the different buckets, right, if you will, in a fully insured arrangement, all we know is that we are paying somewhere between $700 and $900, right, for employee-only coverage across our plans. How Kaiser chooses to split that money to cover claims expenses versus their administrative expenses is something we have no insight into. And again, there are laws in place to ensure that they're not allocating 60% of those funds to expenses, but we don't have insight into exactly what that ratio is. And so in a self-funded environment, not only do we get insight into how many of those dollars are allocated towards claims costs versus reinsurance costs versus your actual admin expenses. But where we also see some of these savings, as I alluded to on the prior slide, is that we're not paying fees and taxes to the state because you're a self-funded plan not governed by the state. So you'll see here kind of the removal of that yellow and blue bar from the fully insured box. These are just estimates here, but these are fees that Kaiser, as a fully insured carrier in the state of Colorado, is required to pay to the state, and they are permitted to assess them through fully insured premiums. As a self-insured plan not governed by the state, those are therefore removed. There's the exception of one federal, we call it a tax. It's not really a tax, but it's called PCORI, P-C-O-R-I, Patient-Centered Outcomes Research Institute. It's a federal healthcare research fund. Those premiums and fees are also included in your fully insured premiums. You still have to pay them in a self-insured arrangement. We're talking something to the tune at your size of less than $300 a year. So it's a bit of a rounding error in the benefits budget, but we get insight into how things are divvied up, and the removal of those taxes and fees often leads to some savings as well.
Are you starting to see any kind of political pushback for basically this level funding and self-funding or sort of workarounds around the state legislature, at least as far as compliance and for the purposes of economics, but you're not subject to those taxes. Are you starting to see any pushback from the state saying, or cities that have gone to this, that their residents are pushing back and saying, we're getting less coverage or something like that, that we don't like this workaround?
Great question. Yes and no. And the reason being is that the legislature is making decisions and the committees, city councils are doing things in a little bit inversely of what they're doing. A great example is that the state of Colorado passed legislation under the Mental Health Parity Act that GLP-1 medications, right, which are what we're seeing for weight loss and diabetes, that under mental health parity, they actually need to be approved under fully insured plans for weight loss. This is not what they're FDA approved for, so most insurers are not covering them for weight loss indications, and many employers are choosing not to. So the state legislation actually passed that and said that coming soon to you, they need to be approved for weight loss. Well, the state of Colorado's benefits plan said we're not covering GLP-1 coverage for weight loss because we have a self-insured product. And so it's a little bit of an interesting balancing act where we're definitely getting some feedback from employees where they say, I've heard in the news that this is going to be covered by, in the state of Colorado, I'm excited for this expansion in coverage, and then having to explain you're a self-funded plan, you're not subject to it. It's not going to impact you. We get pushback from the employees, but the other side of the conversation that the employers are having is in order to bend the cost curve, right, and be able to sustainably offer you benefits that are affordable, we have to make cuts to the benefit themselves, right? Because the dollars have to come somewhere. We can offer a rich benefit that's going to cost a lot. We can offer a less rich benefit that impacts fewer people, but is going to be less out of your paycheck. And I would say by and large in today's environment, the feedback that we're getting when we conduct employee surveys is that money in the paycheck right now is more valuable to people than access to GLP-1s for weight loss or fertility coverage, right? Those state regulated benefits. So long-winded answer to your question, but a little bit of both.
Rob, is your question maybe, is there any, apologies for being late, by the way. Is there any
Welcome.
movement towards a self-insurance tax to replace the premium tax, either here or in other states? I thought that's a little bit of what you were getting at.
I think there's two things. I mean, one, if you're basically saying you're only subject to federal requirements, let's say fertility treatments, that's a big deal to hopefully, but if you turn around and then you're banking on this type of a level coverage analysis, some people unfortunately are not, that could need that, are not able to get that. And I'm wondering if that, when you talk about the premium tax of 2% in this example, what the trade-off is. If people are getting so much pressure to save 2%, that, good, we have to limit some things. Or some people may say fertility coverage is so important that it's worth the 2%. That's one thing. And then, as you mentioned, Dave, I think the idea is that I would imagine in a lean state budget climate, the state doesn't like municipalities doing something like this because it cuts out basically a tax revenue stream.
That's fair. Yes, I don't think the state loves it, to be quite fair. I will say from a revenue stream perspective, it's hard to say, but I think the amount that they're receiving from this, especially from employer populations, is not incredibly high, to be quite frank with you. To your point, if I was only positing 2% savings or 4% when we combine the two, in moving from a self-insured or moving from a fully insured to some sort of self-insured arrangement, I don't have any organizations I work with that typically are willing to make that change for only 4% savings. Where the savings really are actually typically coming from is that you in your current fully insured arrangement, to get a little bit more technical, in your Kaiser environment are underwritten on what we call a manual basis at your size. This means that Kaiser's underwriting is not really based on what is actually happening in your population from a claims perspective. They're basing it on your demographic risk and their book of business. So Kaiser's basing this on we're insuring 5 50-year-old men who live in the 80210 zip code, And we know that on average across our book of business, those individuals are going to incur $600 a year in claims costs, right? So that's what we call a manual rate factor, and that's the environment we currently sit in. As I said, your renewals have been pretty favorable, which is indicative of a couple things to us too. But you just looking at the demographics, right, as you mentioned, like police officers, it's a relatively healthy population, typically speaking, compared to other public sector entities. And so where the savings actually come from in moving to a self-insured arrangement is more in the claims costs, right? Because we're not basing it on Kaiser's book of business to insure, on average, a 38-year-old population as a whole. We're basing it on a little bit more on what is happening in your population. Now, I won't say it's entirely what's happening in your population, because at your size, we don't want that, right? If one bad claim hits, that makes for a really bad year. So we still somewhat manually underwrite in a level funded arrangement. We also what we call credibly underwrite, which is based on your specific plan experience and claims.
Well, and I would also imagine, so what I think I heard you say is that there would also be, potentially, could be savings from, in the fully insured plan, Kaiser has to pay claims for everything that the state legislature has mandated that they pay claims for,
Yes.
like GLP-1s and fertility and who knows what else, right? In a self-funded plan of any kind, we would have the ability to say, we're going to work with you, Kaiser, but oh, by the way, we're not going to pay for claims related to X, right? And that would be, I don't know how that decision would get made, if that's like a staff level decision, but is that correct? Like, we could opt out of those things and say, you know, we don't want to support GLP-1s, we do want to support fertility, we don't want to, you know, whatever, so.
I think
Correct.
that goes a little bit to the question that we talked about earlier about why do you want the data? Because you could see some of the drivers then of what might be affecting your data versus you said in the fully funded, you're using averages that may or may not apply to you versus if you're in one of the levels of self-funded, you're seeing the data, you're saying, oh, we're really getting premiums based on, you know, heart attacks, or, I mean, we need to cover heart attacks, or we're really getting a lot of claims based on GLP-1s before they've had a chance to do diet and exercise, so let's change the incentive or something. I'm making up factual patterns, but that's why you see the data.
Yeah, no, a great example is GLP-1s, right? We have very few employers these days that are covering them for weight loss, even though the indications are positive, because the cost is so prohibitive. So if we said we're going to offer them for weight loss in the coming year, and then we get the data back and it says, wow, we've spent $600,000 in claims, and of that, $200,000 were spent on GLP-1 medications, which is not an unheard of ratio. We could then choose the following year, right, to say we're no longer covering them for GLP-1s. Now, we'll always cover heart attacks, so don't worry about that, I promise. But GLP-1s, fertility, those are a couple of the more recent ones that, yes, we have the ability to.
Yeah. And I would imagine even some of the borderline elective surgery type procedures, bariatric surgery, those types, some plans cover that, some don't, some, you know.
Yes, yep.
So is there more to the presentation? We have about 10 minutes. I mean,
Our last slide here is just Q&A. We've included a lot of information in the appendix for your review. Again, I think these are best discussed in a future study session, but information on things like the reinsurance mechanism called stop loss insurance that exists within this type of policy. We've also included the exact.
For 1 minute, do we have a minute if we've already talked about it, I can make a call offline, but to talk about the stop loss a little bit in detail?
we have not talked about it, so I
Yeah.
How it works?
Yeah. So for those who don't know, right, in a self-funded environment of any kind, level funding or true self-funding, the question is, what happens when we have a catastrophic claim, right? And in a level funded environment, like I mentioned, we are paying set monthly premiums. So if we have a bad claim, it's not going to hit the bank account, if you will. But the mechanism that exists to protect against that is called stop loss. You might have also heard this as excess loss insurance, reinsurance. It's insurance on top of your insurance policy. And the way that this works is it basically limits your liability in two forms, but it limits it to a specific amount and or percentage, which we'll get into on the next slide. The biggest piece to note is in a level funded environment, your stop loss insurance is provided to you by the carrier that you are contracting with for the level funding mechanism. So it's included in your monthly premiums. It is something that it's important to understand, but it is not something that we're pulling any levers with, right? It's included in your level funded policy. It's part of your premiums. That's the biggest piece to note. The two mechanisms by which it protects you are most importantly specific stop loss, which is the most expensive type of stop loss, and you at your size will carry both types of stop loss. The way specific stop loss works, otherwise known as individual stop loss, you'll also hear this referred to as ISL for short. It sets a specific dollar threshold that you are protected above if you have an individual who hits it. So let's say we expect everyone in your plan to use $900 of claims costs a month. That would be high, but $900 a month. And then we have someone who gets in a car accident, has a heart attack, gets cancer, right? Those costs can easily exceed $1 million. So the stop loss threshold exists, and it's set based on your size as your employer. We would typically set that threshold between $25,000 to $50,000 at your size. So any claim amount that exceeds that threshold for that one individual for the plan year is no longer counted against your plan experience. It's no longer factored into your claims renewal. It is removed, right? So it's a way that we protect the plan against really high cost claims. And about 60% of employers these days have at least one claim that is exceeding $100,000 a year. 50% it's exceeding $500,000 a year, right? The costs of goods and services is going up. So we call those stop loss hits, right? Something that's hitting above your threshold. So that's specific stop loss, and it's the most important one to carry. The second type of stop loss is called aggregate stop loss. I don't have our next slide in here is on aggregate stop loss. And the way that this works is it basically protects against what I call a run on the bank. So let's say we estimate everyone on your plan is going to have $900 of claims costs every single month. But let's say each one of those people has $1,100 of claims costs a month. They're probably not going to hit your individual specific deductible, but the plan as a whole is going to run really poorly. And so your specific or your aggregate stop loss sets a threshold at a percentage. That threshold in Colorado is typically 120 or 125%. So if we anticipate your total claims costs for the year to be $1 million, if the plan has claims in excess of $1.2 or $1.25 million, that's when the aggregate stop loss kicks in. Now again, all of these in a level funded arrangement are mechanisms that happen behind the scenes. So we are still paying level set premiums every single month, regardless of the volume of claims, the severity of claims, the cost of those claims. But those mechanisms are what Kaiser uses in the back end. And then we, as I talk about dividing up costs, have insight into how much you're being charged for each of those stop loss policies. So if Kaiser came back to me and said, we're going to charge you $400 a month for claims and $400 for stop loss, we've got a problem, right? That's too much money for stop loss. It's half of your costs, right? So we're able to also get some insight into that and negotiate where this mechanism currently exists in your policy, and we, again, don't know the breakdown of those costs. So that's a very brief overview into stop loss.
Super helpful. One follow-up question, if I might.
Yeah.
Does Kaiser, they're not worried about our risk, obviously, but in the aggregate, all of their insureds, do they lay off the risk anywhere? Do they buy reinsurance?
They do. So Kaiser, I think they've got one or two reinsurers. In like the truly self-funded market, there's carriers that you've heard the names of, like Voya, Sun Life, Swiss Re, Berkshire Hathaway. Those provide stop loss carriers or stop loss insurance to large self-funded employers on a standalone basis. And they also will insure at a very high level the Kaisers of the world who are offering level funded insurance. It's in the millions of dollars, those limits. Yeah, but great question. No.
I think particularly with, so many of our employees being police officers and the potential for very large claims, that would be important to us. So, quick question, I think I probably already know the answer, but I think, the more I hear, the more I think, okay, why would anyone continue with the type of plan we currently have then? And so just making sure that I understand, pros and cons to everything. Sounds like there's a lot of pros for a level funded plan. What are what am I missing? What am I missing? Why haven't we done this already?
Yeah.
Can I ask a quick question? So, say we go to level funding and our premiums come back 20% or whatever. Can we always go back to the fully funded?
You can, yes, and this is the good and the bad, so these questions go together perfectly. So the con here is that, again, you are manually rated with Kaiser. So you have spread your risk across Kaiser's entire book of business. And you've run well, and your population has appeared just to be pretty healthy, which is why we've seen renewal increases as we have. But in a level funded environment, we give up some of that stability, right? Again, you're still mostly manually rated at your size, but there's an aspect of credibility where if the plan runs really poorly, we will expect to see a larger increase because part of your rating is based on what happens in your population. So that is the biggest con, and that is why public sector employers, generally speaking, Colorado, I will say, is a little bit different because these products were pioneered here and they're very advanced, but generally speaking, shies away from self-funding because of the unpredictability, right? The thought is maybe we make some other changes and we've got these renewal increases that we know are going to be single digit year over year. So that's the biggest con. Now, to your point on can you go back to a fully insured method, you absolutely can. And the slide after this one is very detailed and technical, but you don't have any what we call terminal liability on a level funded plan. So you can walk away whether you're in a surplus or deficit position at the end of the year, no questions asked, which is really great. But because of the legislation change here in Colorado, where we have small group is now 50 and under, there's still a small credible aspect to your rating still at fully insured. And so if we get a really poor level funded renewal, we still have to disclose that into the fully insured market, and they will use that in their underwriting come renewal time. So
you'd go back, but it'd be at a higher rate.
Correct, than you may otherwise be if you'd stayed fully insured the entire time. So I know we're coming up on time here, but I think we can certainly dig more into what's on the screen here. The rest of our examples talk about doing a more thorough risk analysis. Like I said at the beginning, I think where we see the most immediate opportunity is in revisiting how we have structured our premiums and coming up with a 3 to 5 year strategy on how to right size them. We can certainly talk about doing that with more immediacy, but I think a 3 to 5 year strategy makes the most sense to bring it back to benchmark levels. And that will be, I think, the number one step in containing costs, and putting level funding alongside that could potentially be a good idea. But something we'll want to explore further.
Yes.
Thank you all for the conversation. Gauging on what we're hearing is that you would like us to continue further examining these options to see what strategically and logically makes sense for our medical.
I think so, and I was going to say, we didn't really have a ton of discussion, but those two things in particular, just like making sure that we're all on the same page, it does sound like people are interested in looking at, what percentages of the premiums and making some potential adjustments there if necessary. Yes, right? And then also further discussions about a level funded plan. Yep.
Yeah, absolutely agree with everything you said. Just maybe one request, if it exists. Examples of where things have gone wrong and why, if there are any, for later, not for tonight.
Absolutely, yeah.
Okay.
Wonderful. Thank
All
you.
right, thank you. Thank you all so much for being here. It was a very informative presentation. Really appreciate it. Moving on, I'll call the meeting to order at 6:29, according to my watch, but, and I'm going to give the clerk a minute to get ready to call the roll.
The point is, you go to the plans, you're saying, if I can get 5 years out, with savings before anything happens, as opposed to, what if my oh shit, this year that I run
Okay.
Heller?
Yep.
over 20 or 30.
Council, the clerk's calling the roll.
Counselor Heller?
Here.
Counselor Eber?
Here.
Counselor Holland?
Here.
Counselor McGuire?
Here.
Counselor Robinson?
Here.
Counselor Fisher?
Here.
All right, please rise for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Next up is audience participation. Don't see anyone signed up. Is there anyone who wanted to sign up? All right. Moving on to the consent agenda.
Mayor?
Yes.
I'd like to remove item 6B from the consent agenda.
Okay, 6B. There is also it looks like there's a corrected change to the minutes. Does that need to be removed from the consent agenda since it wasn't part of the packet? Why don't we do that just to make it cleaner? So we'll remove the minutes so we can approve them as amended. And then that just leaves then the unique zip code information.
I move to approve item 6C of the consent agenda.
It's been moved and seconded. All in favor?
Aye.
Any opposed? That passes unanimously. We'll circle back to the June 2nd minutes. On the dais, there is one small change to page 13 of 14. So I would entertain a motion to approve the minutes as amended.
Move to approve the minutes as amended.
That's been moved and seconded. All in favor?
Aye.
Any opposed?
Yes.
That passes unanimously. And then last, Councilor McGuire, Resolution 21.
I didn't see anything in the material that we were provided about the consent to assignment regarding the Castle Crown Wireless Communications Master License Agreement. I didn't see anything in the material about whether any due diligence was done on the assignee, that we're comfortable the entity is able to perform the obligations under the
Yes,
contract.
I actually did do some due
I
diligence.
knew you did.
And yes, they are. The only thing they don't have yet is their, what is it, foreign registration, because they are out of state. But they, yes, they are well-funded, and they've gotten everything they need from the FCC, have been approved for the takeover, and they are financially able to move forward with all of this.
Thank you. I would have liked to have seen that in the materials that we
Okay.
were given, so next time, just a
Susan,
heads up.
I raised a similar question, but more narrow, just about the credit risk. Is it higher or greater with the acquirer than the selling entity? And the answer was similar.
Yeah, similar.
Councilor Robinson.
I was just going to say that the new assignee is the largest carrier in the country in terms of the local cell towers, and the deal closed over a month ago. So obviously, we didn't matter very much to whether they were going to do it or not. So, but anyway, they're the largest carrier in the country.
It certainly explains a lot of, now a lot of things make sense.
I move to approve item 6B on the consent agenda.
Second. Sorry, all in favor?
Aye.
Any opposed?
Aye.
That passes unanimously. All right, moving on to unfinished business. We'll start with the 2025 audited financial statements. Director Newman.
Yes, thank you so much. I would like to introduce Paul, our fantastic audit partner from CLA, and he's going to give us an overview of the 2025 audit.
Thank you and welcome.
Well, thank you so much for your time, Honorable Mayor and members of, City Council. Today, we're going to make some brief comments about the audit process and talk about the audit results, and then really focus on your role as governance in terms of city finance and what the audit role means to you as we go through the slide deck. I just want to remind each of you, we work for you. We don't work for management. We work closely with management in order to get this to the finish line, but our role and our responsibility is to perform this for City Council. And so we take that very seriously as we walk through the slides together. So if you go to the next item, we're just going to briefly talk about our responsibilities and more in particular your responsibilities, management's responsibilities, and what an audit is. We'll talk about what we scope to do and the results. And then finally, just talk about governance communications, which are required audit standards to make sure you understand how the audit went, any things that we had in terms of challenges, and your role as we go forward. On the next slide, we talk about responsibilities, and you fortunately only have 2 bullets, so you consider yourself very lucky. But in terms of providing strategic direction and accountability, the city of Cherry Hills has a smaller based team of finance professionals, so your role is even more critically important to challenge and understand your financial obligations, the financial information as presented, and being good stewards of those taxpayer dollars. Management is responsible overall for the internal controls, the accounting policies, determining those in accordance with generally accepted accounting principles, and also adopting programs and controls in terms of deterrence of fraud and other activities. And then finally, our role is to opine on those financial statements that are presented by management. We also are required to present internal control deficiencies or items that we think could be improved on as you move forward, as well as evaluating your financial statements on a risk base, i.e. you get more attention to things that have more quantitative risk as qualitative risk. As we go to the next item, this is what we were engaged to do by City Council, and so issue an opinion over your financial statements, issue an internal control over those financial reports, and then communicate all of our items in terms of a letter if we deemed necessary, and we'll go over that in just a second. And then we also wanted to highlight 2 things that we do as a non-audit services, and we had this in the engagement letter, but just wanted to bring it full circle at the conclusion. We did prepare your financial statements, and we did assist this year in the implementation of the new pension plan that was presented within your financial statements. So let's get to the good news. The audit was issued with a clean opinion, unmodified opinion in all material respects, the highest standard you can get in terms of an audit opinion. So that's a very positive item. We did have 1 material weakness and a significant deficiency as a result of performing our audit. I talked about the internal controls and evaluating those, and then reporting back to council. As you go to the next slide, we talk about this a little more specifically, what those relate to. And the item, the first one is segregation of duties over journal entries and P cards. And I want to highlight this was related to early 2025. This was corrected soon thereafter, but we wanted to bring your attention because that was the period that was under audit. The other item was a material weakness over your water and sewer capital assets. There was an addition that was made last year that was expensed, and it was caught in the current period and was for $36,000. And so we recasted or made a prior period adjustment to apply that at a fund balance or equity and move that to a capital asset. Again, the dollar amount is not significant to the overall entity, but because it deals with the water and sewer funds, which are very small in totality compared to the city as a whole, it was required to be restated based upon the dollar amount presented. And then there's 2 other items, debt covenant compliance. Going back to 2017, the EMMA, which is a requirement to file your audit with, and also compliance with that reporting body was not performed, and that has been retroactively applied and is performed and is up to date. And then also there was a property tax allocation item related to the current year receivable. So this had no impact on your reporting for the current period, but it was more of a receivable as your current collections in the subsequent period. And then finally, it doesn't look like we have a good slide in terms of contrast, but I'll help you. Overall, we did issue that unmodified opinion. We did not have any disagreements or opinion shopping or anything like that, and that's a requirement to make sure that we come to you to let you know that it went smoothly, because we didn't give you the blow-by-blow of what happened during the audit process, but we want to let you know that everything we requested was received, and we did not have any items that were left in disagreement. There were some estimates related to your financial statements, not an exact science, notably your estimated useful life of your capital assets. Those are all estimates. We don't know for certain if a building's going to last 30 years or 40 years, et cetera, and we just wanted to highlight to your attention. Then finally, from an other standpoint, we recognize the great work that management did. We appreciated all their requests and the information they provided, and we also want to highlight this report was presented 3 months earlier than it was in the prior year as we come together in June. And for those that, the Office of State Auditor for regulatory requirements due by July 31st without extension 2026. So that this was reported and concluded in May 13th, 2026. And then finally, on that previous slide, we had a GASB 102 for those keeping track at home of what all the GASBs relate to. This one relates to constraints or concentrations of a government. So if you had a certain concentration with an employer that had significant amount of property tax or taxes coming in, and they were to leave the municipality, it would have a significant constraint on the ability to provide, or you were dependent on a certain provider, and if they were to leave or go out of business, we did not have any of those items that not disclosed within your financial statements, but we did evaluate compliance with GASB Statement 102. At this point, I'm happy to address any specific questions you have as your external auditor.
Any questions? Yes, Counselor Heller.
First of all, nice job. Second of all, apologies. I realize in advance that I'm going to be asking some questions in the context of the private sector, but just be good foundational sort of education. You mentioned non-audit functions from a governance perspective. In the private sector, not permitted to do those without governance approval. Is there a similar, for obvious reasons, there could be a conflict. Is there a similar governance requirement in the public sector?
There is a communication in the engagement letter where we show what we are doing as a matter of convenience for the government, and then we also evaluate management's ability to do those services as more of a convenience factor. And so they take ultimate responsibility. So that engagement letter that we go through council or signed by management highlights that although we are doing it, you are required to take responsibility for those services and oversee those services as performed.
Okay, that makes a lot of sense. And the second question, if that's okay,
Yeah.
Mayor, I mentioned this to the city manager and he answered it already, but I'd like to hear just your answer if that's okay. In the private sector, material weakness is a big deal, public disclosure, et cetera. It looks like by the facts here, what was found, it's not as big a deal. Can you kind of give me some context?
I think the context is it's not the same as a public company, first and foremost. There's more quantitative evaluation. So anytime we have to restate, and it was right about the threshold for that very, very small fund, we're just required to communicate that as a matter of public preference to evaluate that. And we will come back next year and make sure that those capital assets and all the corrective action plan has been resolved.
Makes sense, and that's what Chris said. But one follow-up question, then I yield,
Yeah,
Mayor.
okay.
But no consequence as a result of it being a weakness, a material weakness, or significant deficiency? I might get those wrong, but the three categories. What's the consequence of the characterization?
The consequences that you're going to have to continue to evaluate that specifically your capital assets. As stewards also of federal dollars, it puts you in a different risk profile. Now, this year, we did not complete a single audit, which is an audit of your federal funds. And the threshold for that is if you receive over $1 million of federal funds, you're required to undergo a more comprehensive audit to make sure you're complying with the federal regulations. And the requirements, if you had a material weakness, jumps the coverage from 20% to 40%. And that would stick with you for 2 years. So 2 years of not having a material weakness keeps you at high risk.
Thank you again. Nice job, and thank you, Mayor.
Thank you. Yes, Counselor Fisher.
I do have one follow-up question on that material weakness, too. So it was incorrectly expensed rather than capitalized, is my understanding, but that was in 2024. Did a rule change? Why was this not brought up until this audit? Why wasn't this in last year's audit?
That was something that it was not evaluated at that level in last year's audit. It was evaluated differently this year, and it was noted that it should have been capitalized.
Okay, so it wasn't a new rule.
What happened on this one is it was actually capitalized on the governmental activities. And so the asset was just in a different bucket. And so it was just moved. You'll see a slight change in your governmental, so all the city funds that are outside of the water and sewer. And so the asset was picked up, but it wasn't picked up in the right fund.
Okay.
One of the pieces I added when I started, especially taking over capital assets, July forward, was going through and making sure that we really had all of our capital assets in the right places, one for long-term planning, and then two, to ensure that we were capitalizing them in our financial statements versus expensing them. And that was another, as we worked through it and made sure we had everything, we did find that discrepancy. And I very much wanted it corrected going forward now that we know it's there and we want it in the right place. So that was part of that.
Any other questions or comments? All right. Well, thank you very, very much. Thank you for diligent work and for your presentation. And we need a motion, I believe, to...
I move to approve the audit of the financial statements of the City of Cherry Hills Village for year end December 31, 2025.
Second.
It's been moved and seconded. All in favor?
Aye.
Any opposed? All right, that passes unanimously. Thank you very much. We will move on to Resolution 22, Series 2026, appointing Hollis A. Crawford and Eric P. Hutchins as alternative municipal judges and approving professional services agreements. Director Newman.
Yes, so as council is aware, we went through a process recently with Judge Elman and a couple of the council members to select two relief judges to support Judge Elman should there be vacation, illness, anything like that. And after a pretty decent process, we have determined that we've got our top two candidates, and we would now like to bring them to you for approval.
Thank you. Does anyone have any questions?
Sorry. I just want to acknowledge that
sorry.
Hollis is in.
I was going to ask, because we don't get many visitors in our meetings, and so I'm guessing we would love to welcome, and would you like to address us at all, or say hi, introduce yourself, and yes.
Good evening. I'm a shorty compared to the last gentleman that was here. I'm Hollis Crawford. I'm honored to be here. I'm very excited for this opportunity. I grew up in Greenwood Village. I'm a Colorado native. I've been here and went to law school in Wyoming and came back here. My husband, Zach, is here to support me, and we just wanted to see everything go through because I'm very excited about it.
Well, wonderful. Well, welcome and thank you. And we're looking forward to having you. And hopefully you'll get to know, it sounds like if you grew up nearby, you probably have a pretty good understanding of our community. And so welcome.
Thank you.
And thanks for being here tonight.
It's nice to be here. It's nice to see a few familiar faces from the interview process and getting to meet some of you. So thank you for having me.
Thank you. All right. I would entertain a motion.
I move to approve Resolution 22, Series 2026, appointing Hollis A. Crawford and Eric P. Hutchins as an alternative municipal judge and approving professional services agreement.
Second.
It's been moved and seconded. All in favor?
Aye.
Yes.
Any opposed? That passes unanimously. Thank you. Moving on, an update regarding the Nexus study. We'll turn that over to Director Workman and Manager Black.
Yes. Excuse me. Good evening, Mayor Brown and members of City Council. As the mayor just alluded to, the next item on your agenda this evening is an update for the parkland dedication and fee in lieu Nexus study. Just by way of brief background, as council will recall, in December of last year, the council approved a moratorium on the submittal and processing of new subdivision applications for 9 months. That moratorium was to give staff an opportunity to get a consultant on board and start the process and go through the process to do a Nexus study for the land dedication or fee in lieu thereof at the time of subdivision application as it relates to park and trail land dedication. In March of this year, council approved a professional services agreement with Tischler Bice to do the work for the Nexus study. And since March, Tischler Bice has been working on this project. In April of this year, Manager Black and myself gave introductory presentations to the Planning and Zoning Commission, as well as the Parks, Trails, and Recreation Commission, introducing them to the project and letting them know that this would be coming their way. We are also scheduled to do a very similar presentation and discussion with them at a joint meeting this Thursday, where we're excited to see what their feedback is as well. And that's kind of where we're at to date. In terms of the work that Tischler Bice has done, they've started with a demographic analysis, particularly focused on population per household here in Cherry Hills Village. They've done a comparative analysis for Cherry Hills Village as well as some of the other metro area communities. They have recommended some changes, which is the primary reason why we're before you this evening. They've done an analysis on the level of service that the city currently provides for parks and trails. And then there is some analysis related to the results of any changes or the proposed changes and how that might impact subdivisions moving forward. Tischler Bice starts their process by understanding the context of the community in which they're working. For them, that means gaining an understanding of the community's demographics. In order to do that, they start with the American Community Survey, excuse me, which is an ongoing demographic program operated by the U.S. Census Bureau, intended to try and keep updated demographic information between the every 10-year census. Within that American Community Survey, there's a public use microdata sample, which is the PUMS. That allows users to create custom estimates and tables for information provided in that ACS program. And then on a more micro level, they use the public use microdata area, which is a localized geographic unit defined by the U.S. Census Bureau that contains detailed survey data collected with the American Community Survey. Those areas have at least 100,000 in population. And another way to say that is those PUMA areas are the smallest breakdown of geographic information as part of the American Community Survey program. The PUMA that the city is in is the kind of bluish hatched area on the image in front of you. Obviously, that is not coterminous with the city's boundaries, which are in red here. And Tischler Bice does have a formula that they use to try and take the information within that PUMA area and more customize it for a community like us in Cherry Hills Village. As you all saw through the packet materials and the memos from Tischler Bice, there was a lot of math involved in this particular phase of the project. The intention tonight is not to go through all of that math in detail, but instead provide a summary. So you'll see the unadjusted table on the left-hand side of the image here. That is reflective of the respondents for the PUMA area, the blue area that was on the previous slide. Tischler Bice, through their math, their tried and true math, has adjusted the values for Cherry Hills Village, taking into account the specifics of Cherry Hills Village. It is important to note that while there are categories here for single-family attached and multifamily, there is no single-family attached or multifamily zoning here in Cherry Hills Village. But including that information is an industry best practice and a standard that Tischler Bice does in all of their reports or their nexus studies like this. Should council desire to remove that information from the study, that can easily be done, but it's being provided at this stage as a best practice. I do want to highlight on the far right-hand table there, the adjusted people per household or the Cherry Hills Village people per household. Keep in mind that 3 bolded number there, because that will become relevant here in a couple slides when we get to some of the justification for the recommended formulas related to parkland dedication and fee in lieu thereof. And as a note, because it also becomes relevant here in a couple of slides, according to Tischler Bice, the city has a current population 6,486, which comes from the State Demography Office. So after Tischler Bice had an understanding of the demographic context of the city, they compared Cherry Hills Village to other metro area communities, specifically 4 other communities in the metro area, and the 2025 national average. Of the communities that were compared, only Cherry Hills Village and Bomar have a land-based model for land dedication. I will say Bomar is probably not doing a lot of subdivisions either, and I do not know when the last time they went through a similar type of analysis, but certainly most of the communities that were looked at that have a similar type of dedication model, whether that be land or population-based, use the population base, and it is an industry standard to use a population base. I also want to note that other metro area communities may have a different model altogether that would require specific acreage dedication for new development based on a park classification or a customized model like our neighbors to the south, Greenwood Village, uses. Those weren't candidates for comparison to Cherry Hills Village because it's such a different, it's not an apples to apples type of comparison. So after looking at the city's demographics and how we currently assess the land dedication or fee in lieu thereof, Tischler Bice is making a recommendation that the city move to a population-based methodology. Specifically, they found that housing type is a more proportionate and defensible way to assess the dedication compared to a flat percentage of the land being subdivided. Specifically because park demand is a function of population, not the lot size, and population is better determined by the housing type than a lot size. In short, here in Cherry Hills Village, right, our R1 zone district has 2.5 acre minimum lot size. Whether that site is 2.5 acres or 3 acres, right, you could still only have one residential unit on it. And so to use the housing units and population is a more defensible, more proportionate way to measure the impact to the park system. So this is staff's attempt to summarize all of the math that was provided to you in your packet this evening. The numbers that are bolded in black represent the park acreage per 1,000 people in the first bullet there. So Manager Black provided all of the park and trail information to Tischler Bice, and we have a total of 80.71 acres of parkland. Divide that by the population from the State Demography Office. That's how you get to the 12.40. Same methodology used for trails, right? There were just over 25 acres of trails here in Cherry Hills Village. Divide that by the population. That gives you the acreage per 1,000 people. To understand that that acreage in per person, that is what's in white on the screen before you. You basically take that park or trail land divided by 1,000. That gives you the per person amount of park or trail space. And then the last bullet there is the total. So in total, the city has about 16.3 acres per 1,000 residents. And I want to focus on the red bullet under the total there because that will become relevant in the future calculations here on a couple of subsequent slides. That 0.049 is the sum of the 0.037 acres per housing unit plus the 0.012 acres per housing unit, one for parks, one for trails. Okay? So understanding the city's level of service at 16.3 acres per 1,000 residents, which was based on that information on the slide before, the Tischler Bice compared that to Inglewood, Centennial, and Lakewood, as well as the 2025 national average. As you can clearly see on this slide, excuse me, the city's current level of service is much higher than our neighbors or even the national average, which I don't think is a surprise, and I think that that's what our community would expect. And not only do I think that, our master plan flat out says that parks and trails are important and we want to keep it that way, right? So understanding that the village has a higher level of service, the revision or the change to how we would calculate the park and trail dedication moving forward for subdivision applications takes that .049, which is the total of the parks and trails, and says that's the current level of service. We are going to maintain that current level of service with that .049 per housing unit. And so these next few slides here run through how the current standard would be applied and then what the population-based method would result in. So a traditional R1 lot would create 2 lots, so you would have 5 acres. So you see the math there, 5 acres times the .075, which is the current dedication. For these first few tables, $1 million was just an assumed land value, right, for illustration purposes. The recommendation is not that we lock in the land value for $1 million. The recommendation is that we would do an appraisal for each time this comes in, so we would know what the land value is at that time. But in order to illustrate how this change would be impactful, we had to pick a number, and $1 million was a nice round number. That was literally the reason we went with $1 million. The math obviously changes the more lots you add, because you are adding more housing units, which again is a better representation of the increase in population, therefore an increase on the park and trail demand. So in this type of a scenario, again, R1 zoning, you would create 5 lots, so you would need 10 acres minimum, which is where 10 acres times the .075 times $1 million, which is what the current standard would be, and then taking the population-based model or the recommendation, you would take that .049, which is the impact per housing unit, times it by the 4 new housing units. That gives you the new acreage to be dedicated, and then again, assuming $1 million valuation, times it by $1 million would be the total 196,000, not $196. That would be not fair. So it was also important for us as staff to communicate a real-world scenario. I use air quotes with that. Some of the factors in this particular real-world scenario may look somewhat familiar to you. So if you have an R3 lot that 2 lots are proposed, the current standard would say that a dedication would be either .15 acres or $156,000 and some change. In the new scenario, and let me back up for just a second and say that again, the math changes when you change the inputs. That's the beauty about math. And so rather than assuming a $1 million land value, the assumed value here is just over $1 million, which may look familiar to some of you. So in a scenario where there was an R3 lot where 2 lots were proposed, right, 1 lot would be entitled to construct an existing home without paying a park impact fee. But if they want to subdivide it and increase the park impact, thereby creating an impact to the park system, they would be required to maintain that level of service, which was established back before at the .049. So 1 new house times the .049 times the land value of just over $1 million would get you to $51,000 and change. So we've reached the point in the project where Tischler Bice has done their traditional analysis. They've used their tried and true methodology and their formulas, and they're recommending this change to how we would enforce and collect the park land dedication and fee in lieu. Staff and Tischler Bice together are recommending that this change be pursued to our requirements from the land-based model to a population-based model. Tischler Bice would then continue and proceed with drafting a final report, ultimately for council's review and acceptance. And we as staff would start to work with the city attorney's office to prepare updated code language for Planning and Zoning Commission review and then city council adoption. That concludes the presentation. Again, this was a very heavy math exercise with a lot of formulas that Tisha Weiss has tried and true. I know I went through it at a very high level and pretty quickly, but if there are questions related to that, Manager Black and myself are available for any questions you all may have.
So I have a slew of comments that are mostly intended as feedback to consider for, as we continue to tweak this report. And I guess I would generally say that I understand this concept of moving to a population-based model. I am wondering if there's an opportunity to have to customize it a little bit for Cherry Hills Village, sort of in the following ways. They specifically talk about how it's more important it's more relevant, the housing type and size is more relevant. And that's when they're talking about single family attached, multifamily, et cetera. But what their model doesn't contemplate is that there are even differences within the type of a single family detached home. So for example, on our larger, and it kind of goes back to the concept of occupancy. And we use the idea of occupancy for parking restrictions, right? We don't ask a school how many students they have. We say what's the square footage of the building? How many students can your facility support? And that's how many parking spaces you have to provide based on occupancy. The potential occupancy of a 20,000 square foot home with 6 bedrooms is different than the potential occupancy of a 5,000 square foot home with 3 bedrooms. And so I don't know if there's a way to contemplate that in this population model without getting overly complicated, that's more than just take the population, divide it by the number of houses, because the more 20,000 square foot houses you build, the more people you can potentially put into them. So that's kind of one concept. And we do have, like I said, there are other cases, parking requirements, other things where it is based more on this concept of what it can support versus how many people happen to be living there now, how many people live there 10 years from now, et cetera, because that changes. Obviously, we don't know what size house they're going to build because this is a subdivision process. And so it may be very complicated and not possible, but I'm wondering if there's a way to think about that. They also, I don't know that this is relevant because it was very technical. They make the statement that the PUMA is demographically similar. They say we realize that the PUMA isn't the boundaries of Cherry Hills Village, but we assume that it's demographically similar, and so therefore, right, I'm not sure that that's a true statement. I don't know if that impacts the outcome, but if it doesn't, then I don't think we should have that statement in there. Because east of I-25 and Greenwood Village is a lot of multifamily, much more dense development. The west side of Greenwood Village is very similar to Cherry Hills Village. The east side is not. And so I'm not sure if that's an accurate statement. You mentioned the multifamily and attached housing, and they say it's the standard and it could be useful in the future, and I guess I'm wondering why. And how you come up with any model of how many people live in an attached home in Cherry Hills Village when there is no such thing. So I would prefer to leave that out because that data is completely made up. They also talk about the adjusted number when they get to the 3, from 2 point whatever to 3. There's no talk about how that adjustment is made, what it's based on. I worry that that might be a weak point in any future legal challenge, analysis, whatever. How did that adjustment get done? There's also it's a very circular, they use the population and the number of people per household unit to then estimate the number of housing units. We don't need to estimate the number of housing units. We know that, right? We get county records. We know how many people pay property taxes. Like that, we don't need to estimate that number. I don't know if that's a close estimate. If it's if it's one or two houses off, okay, fine. It probably doesn't make any difference. If it's hundreds of houses off, it might make a difference. The comparison to other jurisdictions was interesting. At first, it struck me that Greenwood Village is not in there, and that I think is the community we're most similar to. But that being said, the more I thought about it, there's no assurance that the way they're doing it stands up to any legal muster either, right? So I don't know that, maybe that's not relevant at all, particularly like in Bomar's case. However, I did think it was interesting when they talk about the current conditions, and I understand the logic of you can't charge these impact fees and land dedication based on an improvement. It needs to be sort of current conditions. Is there any way that Inglewood actually has 10.7 acres per 1,000 residents? I don't know.
I would rely on Tischler Bison.
And again, I mean, maybe it doesn't matter because that's their problem when it comes up, but I was kind of shocked by that number, and that seems like Inglewood is charging to improve the park and open space, because I doubt they have 10.7 in their current conditions, which is what their policy supports. But again, who knows if their policy would withstand any legal test anyway.
I think Tischler Bice did their park impact fee. So I think they got that number from their own records.
I mean, that's a lot for the number, their population. Where is all that open space?
We can ask them to
Yeah.
provide that.
Okay. I mean, I don't know that it matters.
Yeah, I know, but still, it's,
Section 2.1 of Tischler Bice's memo has a quote that says, "This is especially the case as single-family detached units and lots are becoming smaller while still serving family household sizes." That is not true in Cherry Hills Village. Houses are becoming bigger and bigger and bigger. And so I don't know if that materially impacts their findings, but that feels a little bit cookie cutter and not particularly applicable to Cherry Hills Village. This note, you fixed it in the slide, but I was very confused for a while in the staff memo because it said 0.49 people per household instead of acres per household. And I was like, wait, where'd we get to 0.49? It was 3. Anyways, I figured it out, and it's correct on the slides. The other thing I'm wondering if there's a way to factor in is a concept of whether this population model is if it fits directly in our context where subdivisions are occurring in a very small scale. The goal is to preserve open space in Cherry Hills Village. That's what's in our master plan. That's the goal of this policy to begin with. Having people carve out 0.49 patches of open space all around the city is useless. And so it kind of feels like we are left with no way to actually preserve open space. And I'm wondering if there's any way to have sort of a minimum that that could actually be useful in any public way. Like 0.49 acres, I don't even know how big that is in square feet, but it's got to be pretty small. And what I wouldn't want, that leads me to believe that we're basically just going to go to fee and lieu every time. And that's disappointing because that's not the point. That's not the purpose. The purpose is to preserve it. So,
And that fee and lieu will not result in enough money to go out and buy an open space parcel.
right. Well, hold on for a second. So I don't know if there's a way to say there's a minimum size land dedication, and then if it's fee and lieu, we use this model or whatever, but I don't know. Maybe that is, I know, I know.
So
just
on
can
that, go ahead, you go first.
My question was going to be, open space, are you talking about dedicated public open space that the property owner would either have they would either deed it to the city or the city would have an easement for perpetual open space?
Yes, like the land
I just wanna make sure I
dedication
understand.
part of the policy, right?
Yeah.
I cannot foresee any case that has happened in my 14 years at this point where we would have accepted the land dedication.
Yes.
Because,
Often it's reverse engineered,
Yes.
right? Because usually what happens is you have a map of future park construction or open space acquirement or whatever it might be. And you reverse engineer that to how many households you have now and how many you're planning to have with a future land use map,
Correct.
right?
Right.
That's how you get to a 0.49 or whatever. In this case, we have nothing in our master plan to give guidance, to give guardrails as to what those numbers should be.
well, it's also, here, we're going to build this whole new subdivision, and developer, you've got this much land, you've got to set aside
Correct.
this much of
Exactly
it,
right.
and they get to choose when they're doing that. And we have had one that I have been a part of
Yes.
where it did work that way. They were dividing it into multiple lots, and, we negotiated with them about where the park would be. And maybe that would happen again in the future, but, it's disappointing that we're basically just resigning, to fee and lieu, which I guess could then go into a fund to purchase something in the future. But, so anyway, that's just
Well, and
thought.
related on that, Councilman Eber said, this won't generate enough money to go out and purchase new, again, to create a framework. I was going to say scheme, that sounds horrible. A framework that would have a stated goal or outcome to do that. Again, we would have to have some sort of policy document that would indicate how much we want to get, where it would be, et cetera. And we obviously don't have that. We have a general goal that when available, we would like to acquire when it's located in a way that's beneficial. But without something more, it's going to be difficult for Tischler Weiss to create a formula that's
Yeah.
based on something.
Well, we did have, it's not quite that, and it's very out of date at this point, but from my time on Parks and Trails and Recreation, we did have a kind of a wish list, I'd call it, of places where, properties that would be nice to have, or areas where we needed properties, and of course, there were issues around that, because nobody wants, you don't want your property on the list, right?
Yes.
But, and that's, 15 years old at this point, so it's irrelevant. But there were, and we have tried over that time to acquire specific properties. So anyway, that's just that. On page 9 of Tischler Weiss's level of service memo,
Mayor, can I ask a quick question?
yeah,
So if we had something in our, when you say goal, but if we had a more formalized, we want 100 new acres of open space and trails, pick the number out, then that would dramatically change this formula, because we need
Yes.
then a funding mechanism to get there, or not a
Correct.
funding mechanism, but the impact on our ability to get there.
Correct.
That would provide the basis for
The nexus.
math, yeah.
Yeah.
But it all comes down to the nexus,
Yeah.
the connection towards, and the rough proportionality. Because knowing that we want parks is one thing, knowing how much to charge
And
to
where
get
they're
there
at
is
and
the
what
rough
kinds of parks, what
proportionality.
kinds of improvements, right? Oftentimes, communities will say, a neighborhood park is X number, and it's typically has, an active component and an inactive component to it. Then we have community parks that are generally this acre in size, and they will have 3 active elements and 2 passive elements. Then we have, right? And so that's the nexus that those communities would use in order to say, okay, we need 25 new acres of park space, and we anticipate development being X number of units, so therefore each unit has to pay this, right? There's a nexus between what park is going to be there, where it's going to be, what it's going to look like, and the population that serves it, right? The challenge is potentially having a goal of having more parks and open space is good, and we should have that. The challenge for the Nexus study is there's not a master plan, there's not a parks master plan that says we've identified, we want an additional 5 acres in the northeast part of the village to be an active park that's going to be, semi-active, passive. Therefore, we need X number of dollars in order to purchase and construct that park.
And my suspicion, and I'm looking at people who've been here a lot longer than me, my suspicion that the reason we don't have such a plan is because we're landlocked. 90% of these.
I don't think so. I think that there was talk about creating such a plan. Landlocked is landlocked. Houses come up for sale all the time. We've talked about buying existing houses and tearing them down for open space. So that is a reality.
But are there other goals potentially, and maybe this isn't the way it works, so I apologize. We've got a comprehensive traffic study going on, and one of the issues is there a need to improve safety on those trails that are adjacent to Quincy and Colorado Boulevard, et cetera? To make them more safe, it might take more right-of-way, more land, and that's going to cost. You could have an objective, a long-term objective, reduce that to a number of acres, it's spread very long out, to make that acquisition.
And there have always been conversations about how we don't have any parks in the northwest quadrant of the city. And for as long as I've been around, there were conversations around, would it make sense to acquire a property? And when certain houses have come up for sale, does it make sense for the city to look at buying that for a park or for open space? So
Understood, and I get that, and frankly, the northwest part of town is providing more direction than just, anything that comes available. The reason I said the landlocked part is not on the demand side, it's on the supply side. Because when you have a growing community, all those newly created lots are paying into that to fund it. The last time before the most recent one that we had a subdivision that would have paid into this fund was 7 years. And the last one before that was a number of years before that. So our ability to bank on this fee in lieu of being, it makes our undergrounding 1% fee look like Scrooge McDuck.
Well, and
right?
that's why I wanted to clarify whether, because we could certainly put together
We
a
absolutely
master
could.
plan like that, but I'm not sure that would actually help anything because of the comment in Tischler-Bice's memo about the fact that we really need to work with our existing level of service and that it can't be based on a desired future, because one of my first notes was, well, no, we don't want to just maintain. Our master plan says add more. But then I read in their memo that the add more part might be hard.
I think overall, because this is a check-in, right? I think overall, I hear you. I think this is good feedback. Let us talk about this with Tischler, this specific topic with Tischler
Okay.
Bice.
Well, I have a few more notes.
Well,
and then-
just following up on that, I think though that simultaneously, while Tischler Bice is proceeding forward, I think that we all and staff need to be thinking about whether or not there are areas and how we, I'm not saying I want that lot, go back to that list. But as I've talked about in the past, as we're looking again at Mansfield and whether to narrow that and put part of it into a trail, that gets you X feet more of park. If you did that along 10
Yeah.
streets, maybe it generates Y value of new parkland that needs to be accounted
Considered,
for.
yeah.
So it changes that denominator or numerator in the formula overall, because what we did is to get the level of service was divide the amount of parks you got by the number of people. Well, if you're raising, of course, the acreage
Yeah.
of parks, I think that is gonna change it. So
Yeah.
I'm just saying, I'm not targeting anybody's specific private properties,
No,
but we
but-
have some very wide rights of way that maybe there's a reason in place A or place B that you turn around and you convert them from right of way to park.
Yeah, well, and I also think having a master plan that says, you know, we'd like a 5-acre park in the northwest quadrant of the city. So I don't, and that would be something that if we felt such a plan was important, that Parks and Trails could start working on. But, so on page 9, there's different population numbers. And they ended up using the larger of the population numbers, which ends up in the denominator and therefore makes the resulting number smaller. So when there's conflicting population numbers, I think we should use.
I'm sorry, Mayor, which page was that?
Okay, so on page 9 of
Okay.
the level of service
okay, I'm with you.
memo,
Okay.
right? They talk about the two different studies. They have the, what are the names? The first one is the, I think like the census data. And it puts our population at on page, I don't know, it puts our population at 6,354. And then they go and they do this, they have a updated number, and they use a population of 6,486. Okay, this is in this memo. It's Exhibit B. On page 2 of Exhibit B, Figure 1, it says that our population is 6,354. And it says source, U.S. Census Bureau 2024 American Community Survey 5-year estimates. And then on the last page of that memo, page 4, base year population is listed as 6,486. It looks like it's using the Colorado State Demography Office municipal population data. And that's the number they then carry forward through all the math. Now, with rounding, doesn't really make a difference. But let's be consistent and let's use the one that gives us the most beneficial number. And then they make and it was on the slide as well, that park population is a function of, or I mean, that park space is a function of population, not of lot size. And I kind of have an issue with this assertion. Yes, from a park that people use, like this playground here, the size of the playground and all of that is dependent upon the number of people who actively show up there to use it. But I don't think that statement is true for open space. I think open space, when you have one house on a 5-acre lot, even though it's not owned by the city, there is open space. When you put 2 houses on 2.5-acre lots, there is less open space. And so parks, I get it, but they seem to be very focused on what I would call a traditional suburban concept of a park. And we do not have those here, by and large.
Just to clarify, Mayor, are you referring to open space on city-owned open space or open space?
I'm referring to the concept of a
Private
park versus
property.
open space. They talk about everything in terms of parks, places where people go, and that's why they say a park is a function of the number of people. That statement does not hold true in my mind for open space. I don't think that the amount of open space you want is, or that you need, or that your community is founded upon is based on 0.4 acres per person. It's based on, open space is a broader concept. And so that rubbed me the wrong way a little bit.
Can I just add?
Yeah.
Because I'm not sure that I understood, so apologies for that. Open space that is or would be city-owned and maintained, or open space on a private property, or both, I guess?
I guess it's just it's a concept of what an open space is versus what a park is. And we've had this discussion in a lot of ways with Quincy Farm and with, John Mead Park, and whether we should have football fields or soccer fields, or whether it should just be a view. It's something you look at. Nobody just looks, open space is something you just look at.
So I do think traditionally, open space is generally referring to city-owned open space. So if you have a floodplain.
And that,
right? So let us clarify with Tischler
but
Weiss.
that's not my point. Who owns it is not the point. The point is that open space is not a function of the number of people. I don't want to have 0.49 acres of view per person. To me, it is a function of lot size. And this is why we have our building codes the way it is, so that you can't cover your lot from, setback to setback, because the open area in your lot is a function of your lot size, not of how many people live there. Right? I just take issue with the statement that, and this is fundamental with the population model, and I understand, and I would be okay with going with the population model, but it is a fundamental difference of opinion. It is not a per person thing. It is of the entire acreage of Cherry Hills Village, we don't want all of it to be covered from setback to setback with 50,000 square foot homes with 8-foot solid walls and all of that. The trails calculation, and I think I'm channeling my Rob Eber here. I appreciated Manager Black's effort to really inventory all of our parks, all of our trails, come up with all those totals. The trail number, though, is only referring to existing developed trails, and not trails that we actually own that are just open space at this point and don't have a path of any kind on them. And so I think that the trails number is probably much larger and should include trail easements that we own or hold, even if we have not done anything with them. Those are open space.
Plus those that we may want in the future.
Well, we can't, we don't know that, but we do at least know, I don't know that we do, because we've had this conversation a lot, but. But I do think the trails number is probably bigger than just our current developed trails.
I apologize. Yes, we can include those and talk to Tischler Weiss about that. We cannot include desired future.
I was talking about it more in the context of what Chris was talking about.
Like
Actually have an overall goal.
A master plan, if there was a master plan or something.
Okay.
But yeah. But just for this math calculation, right, for the math calculation, we can't, add things we'd like to have into that number, but I think we can add property we do have. And then, for my piece de resistance, our larger, I think that we could contemplate a policy that specifically references our different zoning types. Within R1, 2, and 3, people actually already have the ability to build a second dwelling unit on their property. Not just one, but two. So every time you subdivide a lot, you're not limited to just building one home there. You could build two in those zone districts. And so take those numbers and double them. And then we get very close to where we were before in a lot of circumstances. And only do it in those zones where that's allowed, and then that minimizes, if you saw in their, scenarios where the really small lots are basically, paying the exact same amount as and that was one of the things that people were trying to address back in the day with the percentage. This allows us to say, though, 2 dwelling units are not allowed in these zone districts, and so if you're gonna subdivide one of those lots, you use this calculation, and if you're gonna subdivide in a lot where you can build a secondary dwelling unit, you're paying for 2.
Mayor, that was a very,
I think that, let me just say, I think that's true what you're saying. And just like everything, there's no free lunch. That's good for what we might be trying to do here. I think it's antithetical to the argument we're making with regard to the state mandates that are trying to be put down.
No, but we already allow it.
I know we already allow it, but we don't encourage it.
I know, but it is possible they could do it. If you're
I-
talking about the
I-
number of people who could live there.
so Mayor, that was a very comprehensive list, and I don't know about everyone else, but it's assumed most of my comments. If I could I embellish on one of your
Yeah.
points, unless you're not?
No,
done?
I am done. That was it.
Okay, and it's on the question you raised about best practice on single-family attached and multifamily. And I guess I have 2 questions to add to what you said, not in any way, shape, or form in conflict with. You had mentioned, what is the benefit of the best practice, and I don't want to answer it, but it's probably defending it if we're ever questioned about the nexus and the like. But the question is, the 2 questions are, one, it's along the lines of what Earl just raised. Is that somehow in conflict with our policy on housing and the statewide efforts and the like, that we're including, multifamily, even if it's, and I know, Chris, you and I talked about it, even if it's just an appearance, we're including in a table multifamily.
I agree.
Yeah.
I agree. What's the downside?
Yeah, so what's the downside? That's really the question.
That's my question.
And I'll ask my second, and I promise I'll go
No, you're
mute.
fine.
And the second is, and if I missed this, I apologize, did we run the numbers without single-family attached and multifamily, just to see what the difference might be, if any?
Well, I was very confused about what
So
impact.
taking them out of the table.
Yeah, what impact those, I don't know that those actually factored into the math anywhere. It got very complicated, but it would simplify and make it easier to understand if that stuff is not in there because it's not relevant.
Again, as
Yeah,
Paul mentioned,
Yeah.
we can just take it out.
Yeah, we just take it out. And it won't,
It is
that in and of
because-
itself won't change.
But is it less defensible from if someone does argue the nexus point? I think we want to know the pros and cons here. But is that also true? Those are not in the math? They're in the table, and they specifically say, maybe I misunderstood, that they're included in the table for the purpose of this analysis.
But the number 3
Yeah.
people per housing unit is the only number that ever really then gets used further on in
Correct.
the calculations. I was very confused by that for a long time too. But it would be worth clarifying with them whether those numbers are irrelevant. But they feel if nothing else, they feel very arbitrary, and I don't know that they would be very defensible because they're clearly not based
Yeah,
on
and if they're-
anything.
If they're not in the calcs, why take any risk with them?
Yeah, I agree.
Well, just for me, it was better understand why that's industry best practice, and are there any examples?
I mean, I think their point in saying that it was best practice was just to have separate calculations for different types of housing, because most communities have those different types of housing, and so you don't just charge, the same thing to everybody, but we don't have any of those other ones, so,
Maybe, but it's brought up a few times, and
yeah, it does.
Director Workman pulled it, it was important enough to have it in the slide, which was.
Yeah.
Yeah, for our purposes, it was simply reporting to council, right? This is a
What
check-in.
Tischler Bice said, yes.
Yeah, a report back to you on what they've provided to us to date and get your feedback. So that's why it was included, is to report back. We've heard your feedback. We can now move forward, yeah.
Okay. Do other people have any other questions or comments, or Councilor
I
McLean?
just had one question. Why do we only look
just
at
have-
the impact on, why do we only look at the impact on parks, and we don't look at, for example, there's an impact on how many police officers we need, there's an impact on services that we provide. Why is that not part of the calculation in just the parks issue?
So the short answer to that is because that's the only impact fee that the city has. There, other communities have impact fees for all kinds of things related to that, each one of them justified through a Nexus study. But because we don't charge an impact fee for those other types of services, unless council has a desire to adopt new impact fees, there wasn't a reason to look at them because we don't have them.
I will say, if that is something council's interested in, Director Goldie has been talking to me about a stormwater impact fee as long as I've been here.
Yeah.
But that's a whole separate exercise.
Yes.
Yeah, I completely agree, and add on top of that, that Tischler Bice was only contracted to do
No,
but I agree, I think
understand
we
that,
should
but
now.
I'm questioning whether we
Yeah.
are, I mean, especially if we want to limit how, or preserve open space.
Yeah.
Your concept of, fewer houses on lots of land. That's another
Well, I think that
incentive, I guess.
we only had this one subdivision fee, and it, while it was specifically for open space, et cetera, it probably was sort of blanketly intended to cover everything. Now that we're not able to do that and to have such a broad fee, we probably do need to look at, impacts to police, and we have a very high standard of police staffing. We have very,
Yeah, there's some common ones that I'm familiar with, just stormwater impact, traffic impact, police services. There's communities that have, if you have all residential and no commercial, they charge an impact fee, right? Because most communities are so reliant on commercial sales tax, right? So there are a whole menu of impact fees that some other communities choose to enforce. We just don't have those here.
I would just, if that is something council's interested in, great, we are here to serve. I'm going to.
That would be separate from this effort.
And,
Yes,
and
absolutely.
furthermore, I'm going to say it's not even a second half of this year. I would say maybe that's something we could add to the agenda for the retreat
Yeah.
next year.
Yeah.
We don't have the capacity to.
And then my other question is, so we collect this fee, where does it go? Does it just go into the general fund, or do we put it into the park
No, this
fund,
goes
or-
specifically to the open space fund.
Okay,
And that has parameters that when you look in the budget, it can be used for purchase of open space, maintenance, anything related to parks, trails, and open space.
okay.
Counselor Robinson.
Thank you. So this was all surprising to me in that I'm sorry, I'm going to throw some cold water here, which I know a lot of effort and time and everything else has been put into this to at this point. But I guess I go back to the very beginning, which is what was the purpose of the study that we've commissioned here? And from my perspective, it was to support a policy that is, basically to give the legal support to a policy that is appropriate for our village. And I'm not persuaded yet that a population model is the appropriate one. I think our village is unique it is a land-based place where there are bigger lots or bigger parcels, open space, and so on. And I did not see and hear a compelling reason why we would switch from a land-based model, which I think is a model which discourages subdivisions, which I'm frankly for, and makes it more expensive to subdivide, which I'm also for, and also encourages some dedication perhaps of land rather than fee, which I'm also very much for. And so anyways, a lot's been said. It's very late here. So I'm going to just stop with that. But I frankly would like to see a little bit more of an explanation. It seems to me like the population-based model is much more appropriate for denser populated communities where a park is the solution, rather than places like you were trying to articulate, Mayor, where we have a lot of open spaces, may not be owned by us, but that certainly contributes to the feeling of the village, the rural, serene feeling that's outlined in the master plan. I benefit greatly from the larger lot sizes that are owned by my neighbors, even, and I want to encourage that to stay that way. So I'll stop there. I know it's a little bit of a diatribe here.
Okay, thank you. City Attorney.
Yes, if I may, Council, I would just like to say one of the things that when we first went through this exercise is the purpose of the land dedication, as well as going through this fee study, is that we have to tie the impact of a development to what the city's cost is on that development. So it's not to discourage subdivisions, it's to make sure that those subdivisions that can happen under our land use code are properly giving the city what they need. So I want to make sure that that's clear, that what we're looking at is really the impact of a subdivision, not discouraging how that they happen.
And if I could add to that, right? If the intention is to discourage subdivisions, there are tools to do that through minimum lot size and things of that nature. A land dedication or a fee in lieu thereof is not the appropriate tool to use to discourage subdivision.
I was going to say that, and again, I'm not in disagreement with where your comments are coming from, but the point is when you start to talk about saying, hey, you're opening it up to, has anybody been to Old Cherry Hills lately?
Yeah.
I mean, our current policies do not encourage open space. Okay, I'm just.
Well, it could be worse, but yes.
No,
I hear what you're
it could be
saying,
worse,
yeah.
but that's why this thing is like taking off on a life of its own, which is okay, but then it's like going, well, okay. I mean, I guess to a certain extent, we're saying, hey, if you're here, you made it just in time because nobody else is going to be able to.
No, I don't think that's true. I think that that perhaps the changes that we made to the bulk plane didn't go far enough, and we're maybe, but that's a different conversation. You know.
Let us go back to Tischler-Weiss. I will just say, there is a distinction between public and private open space.
Yes.
And what we are getting at here is public open space. If our desire is to require or maintain or get new open space on private property, we have other tools available for us to do that. We could.
That don't require a study.
And don't require a fee.
Right.
We just mandate it.
Yes.
We have a lot coverage maximum. We could do all sorts of things like that. So I do want to be a little careful. I'm not telling you that Mayor, I'm not saying that what you're bringing up is incorrect. But I have been a part of these. We will talk to Tischler-Weiss. They know more than all of us do, and that's why we have them. But I do think there is a distinction between the public and the private open space side of it.
I'm not disagreeing with that at all. I think there absolutely is as well. Private land is private land. My point is that park space is
Yes,
Not park space is a function of population. How many kids can you have on that playground out there, right? Open space is not a function of
understood.
population.
I get that. I totally get that. And there's a logic to that for sure. We will talk to Tischler Bice about that. If there's a way to get a different formula for open space and parse that out separately, we're beyond my knowledge of how these work. So we will talk to them about that.
Okay.
Yeah. And that's, I don't want to take my quiet, it's just taking notes so that we can make sure that we get information back to you from Tischler Bice, since they know what they're doing with these more than we do.
Okay, any other comments or feedback? Yes.
I just had one question. I'm looking, Emily, at the list of trails that's in the level of service memo that you were talking about. And I don't see Quincy, the trail along Quincy in there.
Right, so the trails that are, the parks and trails that are captured here don't include trails that are in road right-of-way. So these are dedicated trail easements, they're dedicated park easements, trails that the city owns outright, and parks that the city owns outright. But if something's appearing in road right-of-way, that's not, since the dedication is different, and that's really part of right-of-way, those aren't included in level of service for parks and trails.
But could they be?
I was just going to say, my question is, following that is, couldn't that part be transferred in essence from right-of-way to parks?
I'm just saying, it's such a
So that
highly used
then
trail.
you add all of that in, and, you know, we'll just, I mean, I know there's some logistical difficulties, but, you know, in essence, it means right-of-way has to cede part of its right-of-way, and it becomes park, but I think that's doable.
I don't even think we have to.
We would not want to change the land type from right-of-way to city-owned.
I don't think we would have to. This is just a calculation that has to be defensible and make sense. And I think to say, this is a trail, it's clearly a trail. Whether it's in right-of-way or
We will explore
easement
that
or
further.
whatever, you
Yeah,
know.
our initial discussion was that since that's right-of-way, it does not
I
count
disagree.
within our level of service, but that's, we can clarify
We
that with them for
will
sure.
explore that further.
Well, the one thing you have to be cautious of is again, anything moving from right-of-way into park, and then again, with the charter amendment in terms of the flexibility that the city has one way or the other. You got to keep
But
that
again,
in
like,
mind.
I don't think
but
we have to
if it
move
moves
anything.
into
We don't have to
park, that's-
rename anything.
All I'm saying is
Yeah.
that needs to be evaluated with council and to make sure that at the end of the day, you know exactly what the implications are of what you're doing. If it has a pure
Yes.
impact, that's perfect.
We should
do it if that's all it does.
Well, I
Right.
think
I just think we need to say, you know, this is just a list of how much trail, you know, acreage of trails. And that trail along Quincy is absolutely a trail. I mean, there's no question. There's, whatever it's legally, you know, recorded with the county, that's not the issue. It's clearly a trail. Okay.
So one last comment. Just based on the level of discussion tonight, we will evaluate moving forward after talking with Tischler Bice. We may need to come back to you with an extension on the moratorium.
Okay.
The level of time and resources needed to go through this will probably extend beyond our current. But I'm not saying for sure, I'm just giving you a heads up that may be coming your way.
And is there, I know that there are issues with lengths of moratoriums. I mean, we're actively working on this. We have, is there, is that?
So as long as the city is actively working through it, I think it's fine. Our moratorium right now is 9 months. Yes, that's correct. There have been moratoriums of a year that have been upheld. I wouldn't want to go further than that, though.
Okay. Good to know. All right, thank you. The next item is Quincy Farm Visioning, Manager Black. Oh, yeah, okay. That's all right.
Okay. I think we're set.
All right.
Okay.
Manager Black.
Thank you for that minute of transition. So this is the third and final step in our process with council for council to create a long-term vision for Quincy Farm. So you'll recall we kicked this off back in February, establishing the goal and setting expectations. And at this past May 5th meeting, we had the bulk of the vision discussion. And tonight is the presentation of the vision document for final approval. So you'll recall at the last meeting, we had a whole list of goals. Tonight, we basically have one combined goal. And it's really to memorialize the decisions that we already made at that May 5th meeting with all of that discussion via approval of the vision for Quincy Farm, which is attached in your packet as Exhibit A. So nothing you're seeing from me tonight should be new information. We're not asking for new decisions to be made, really. This is just solidifying the past discussion in a document. So at that last meeting, council considered 4 possible vision options, ranging from very passive at Vision A to more active. We heard a recommendation from the Cherry Hills Land Preserve and their historic expert, Harold Skramstad. And then council had a robust discussion, and we sort of went down the line with our conclusions that everyone reached. So these are the decisions from that last meeting. Council coalesced around the fact that the Anderson House should be removed from the site. The Hopkins House should be rehabilitated, subject to cost, obviously. Small private events can be held on the west side, and then small to medium private events can be held on the east side in our renovated barn. And this general agreement most closely matched Vision A out of the 4 options that we were discussing. So attached in your packet is the vision. It has 6 different sections: background, prior visioning, the vision itself, key principles, which council had decided on back in 2025, and then more details about both the east side and the west side. So here is the full vision that we crafted to reflect the decisions council made. I do want to acknowledge that this is a high-level vision. So there are still many details, obviously, that we'll be working out when it comes to implementing the vision. So all of the detailed decisions, exact parameters around events, population sizes for events, hours, details about improvements to buildings, those will all be coming to you at future meetings in different documents, policy documents, event policies, future annual plans, all of that good stuff. The purpose of this vision is really to create a high level direction that we can use when we're going through developing each annual plan every year and checking that to make sure that it matches what council's vision was for the property. So some next steps that we have coming up for Quincy Farm related to all I just said. The first big one is the East Side Farmhouse renovation. This is going to be the support building for the big barn. So we're hoping to get that out to bid this summer, and then that contract will be coming to you all for review this summer, and then hopefully getting underway with construction early this fall, and then lasting into winter. We are also going to take this vision after tonight and then start working on the 2027 annual plan with the Land Preserve and our Quincy Farm team. And our goal is to bring that back to council on August 18th, really in time for budget season so that we can start making those decisions. That's all I have. There's a motion for council. The Land Preserve is here if you have specific questions for them, and I'm happy to answer any questions.
All right, any questions?
I have one
Yep.
question.
Councilor McGuire.
I don't know if this is just a wording question or if there's a philosophical issue. When you talk in the vision about the west side of the farm, you say the Hopkins House will be rehabilitated to host small public and occasional private events, which I'm fine with that. But I was under the impression when we talked the last time that we had said small private events on the west side, not just in the Hopkins House. So, or public events. For example, stargazing. I know we've done on the west side, not in the house, out in the field. So I don't think that the small public and occasional private events should be limited just to the Hopkins House. I think that should be for the west side of the farm. Does that make sense?
Yes, I agree with you. I don't think that the wording precludes any of that from happening. I think we were just trying to clarify the purpose of the Hopkins House renovation.
Well, I guess I would rather, I wouldn't want it to be interpreted that it does preclude it. And so I would rather see the west side of the, maybe a separate sentence, you know, the Hopkins House will be rehabilitated, period. Small public and occasional private events can be held on the west side of the farm.
I don't agree with that. And I find it very difficult to approve this with key terms like private event, small event, medium event. From the easement itself, what does no commercial uses mean? How have we applied it? I find it very difficult to create policy without defining these terms. And I thought what we had agreed to was private events, undefined as it may be, would be allowed in the house, but not elsewhere on the west side, which there is a bias if you read the totality of the easement and other documents. I think, by the way, stargazing would be okay, based on what I read and the totality of all the different, often conflicting provisions, is that it's supposed to be for the west side in particular, for nature, historic, educational, you know, et cetera. And private events, I think, connote something much broader than that. I thought we did agree that the house would be okay for that. That's because we're making the investment, but not the west side generally.
In my mind, as long as we're saying small events, yes, we haven't defined what it is, and that will come back to us and will be defined, I'm assuming, right? So the fact that we don't define it here doesn't worry me because I know that we will define it.
Yeah, and in fairness, you guys agreed to that. I was the lone voice, so I'm not trying to relitigate that point. It's going to come back to us. But I still find it difficult, and I wanted to just say that. And I did have a little bit different read about the use of the west side in the Hopkins House.
Councilor
Asked
Fisher.
and answered. I agree with you, Susan.
Well, one thing is I appreciate this process, and I enjoyed reading it again this time. And I particularly liked the, I think I highlighted every word in the little section where you explained preservation versus rehabilitation versus reconstruction. And I would encourage all of us that when we're talking about these next steps, that we just use rehabilitation, which is what we're doing, right?
Well,
To the
so
house.
actually, I have, one of my comments is that my understanding of what you all decided was that you wanted the Hopkins House restored. And then further up so on a couple of my comments on Exhibit A, page 3, under the east side, it says, the central feature of the barnyard is the rehabilitated big barn, or it says renovated big barn, and according to your definitions, the big barn has been rehabilitated, not renovated. So we should use that word there. And then down below, what I heard was the Hopkins House needs to be completely restored. Okay. I heard a lot of, I guess I'd have to go back and listen to that again. There was, when we went down the line with those 4 things, most people said,
And the outside, using that would be restored. The inside was not. That was specific.
so I'm going to have to go back and listen to that again, because I really feel like you all said
I think
redo the interior as well.
We specifically talked about possibly moving some walls to make spaces more conducive to having meetings there. Rehabilitation is what I thought we were talking about.
If I can jump in and
Yeah.
clarify, because I think this will help. So restoration is, I agree, Mayor, I think some people were using different terms, maybe. But our conclusion was that the agreement amongst council was to rehabilitate the house. Rehabilitating means you keep the exterior is historic, but you can do some remodeling. Basically, you're changing it for a new use. It's no longer going to be a house, right? So once you take it away from house and you start having small events in it, no matter what the events are, you're doing a rehabilitation rather than a restoration. A restoration keeps the house basically as close as possible to existing, and you're presenting it as it was in 1898, or you pick really the time period in history you're aiming for, and it's essentially a museum. So I did not hear agreement amongst council that we were going for a restoration and basically creating a historic museum. I did hear agreement that we were going to rehabilitate the house and fix it up for a new use, which is what the rehabilitation is.
And I think after going back for the recording, there was also additional comments that talked about the fact that it wasn't a blank check as well, that there was
Yes.
some reasonableness standard.
Well, I mean, and that's defined in the vision, but
Yes.
it was, and if everyone is clarifying, my understanding of what you all said was that you wanted the interior and the exterior to be, and obviously it's not going to be a house, but as I read these different definitions, and I did read them very carefully, the one that I thought I heard people say was restoration. And that it would look on the inside like, an 1800s farmhouse, and that you could have, but there wouldn't be any furniture in it. It's not a museum. It would, it's not going to be furnished, but that it would look like the house looked. But if everyone else is saying that that isn't what you said, then, and you're all in agreement with that, then that's fine too.
I don't
Can I
remember.
weigh
honestly.
in?
Yeah, Councilor Robinson.
So Mayor, can I make a comment?
Yes.
So I think I was the one that proposed that. That was my original thinking, was that it would be restored to look like a dairy farmhouse in 1890. But as I recall, we had a pretty substantive discussion where others on the council thought that the outside would be restored, but the inside would be modified so that it could be used for events and other things that would be a little bit more open than the way it currently is. So that was my recollection of it, and I frankly am okay with rehabilitating the Hopkins house.
Okay, so it does sound like I was remembering that incorrectly. Yeah, okay. Are there other comments?
Just,
Yeah.
it is a comment, and as was the case with the other issue, this was asked and answered and litigated. I just want to go on the record, again, relative to the Anderson House removal. I don't have a problem with it. The easement contemplates it, I think, because it does say if it is removed, it can't be replaced with another structure and has to be landscaped. So no issue there. I just want to repeat that if we have time, and it looks like, when would the Hopkins House, Anderson House, sorry, be demolished? Probably not for more than a year, longer. Is there time to get some public input? And I completely understand, Earl, and I agree with your point that, we're elected officials and we're here to, I think your point was to make decisions, we're empowered to do so. But because of the finality of a demolition, and because of the historic designation, which the Anderson House is part of. Maybe it's not as important, I don't know. I just think it's worth getting some further input, and I wanted to state that. I know it's already been asked and answered, so I'm not asking to relitigate it.
I have a couple of other things. On page 2, under the vision, so just knowing that in these types of documents, words matter. And I hate wordsmithing, but words matter. The very last sentence at the bottom of the page, it says, "The big barn will host public events and some small to medium private events as well." I can tell you that people who don't agree with this vision, the second there is a birthday party in the barnyard, they're going to come forward and say, this says that the events have to be in the big barn. Yeah, on page 2, the last sentence.
Versus the east side
It said, it
overall.
basically says that only the big barn will host public events and some small to medium private events as well. Not the barnyard, not the farmhouse, not the baby barn or the stables or anything, just the big barn. Yes, that is not my understanding. of
Yeah,
what-
I think isn't this the case is that it was trying to talk about the big barn. It's basically saying, this is what the east side's going to be. It's activity focused. And by the way, you'd be allowed to utilize the big barn for smaller public events.
I will say, I don't think we were intending for either the east side or the west side to limit it, so maybe it does make sense
That's what I'm just saying. the
to add a
words matter.
clarifying statement for both sides, because I really don't think we were trying to
Yes.
artificially limit it to the structures only. So I do think there's an opportunity tonight to clarify that.
I think that would be important. And then on the next page, under the west side, in the first paragraph, it says, it's the third sentence, the Hopkins House is a standalone historic feature. That wording is misleading to me. It is not historic on its own. It has a historic designation as part of a historic district. It does physically stand alone. It is a standalone structure. But it is my understanding that it is not a standalone historic structure. It's not historic on its own. It could be, potentially, but that's not the way the historic designation was written.
Standalone designated structure.
Right.
I see.
So I don't know what the standalone, because.
What it meant to me, and I don't know, and Emily, you comment, to me, what it meant was, hey, we know the big barn was important for a number of reasons, including the donor, Cat. But the real historic structure that goes back to the 1880s is the Hopkins House. That is the historic structure on that property, not historic register, but in terms of anything that someone might really be interested in. That's the way at least when I read that language that Emily wrote, that's how I took it and didn't even ask about it because that's what I thought it meant. But Emily, you talk about what it really.
I'm going to put my Harold Scramstad hat on, if I can. So some of the discussions that we've had with Harold, and some of this wording is coming from the fact that the Hopkins House is the only structure that's designated for its architectural significance. So that's part of the distinguishing feature of that structure. The rest of the property and the historic designation sort of speaks to this fabric of it being a working farm. The Hopkins House is a little bit different in that, A, it's an older structure, it's the original structure, and it's architecturally significant in a way that none of the other buildings are. They're just stick-built barns. And a large farmhouse. So that's a little bit of the reason for that wording, but I can also understand your concern that it
Because I would take an issue with that. I mean, the historical significance is defined in the historic designation.
Yeah, I was going to
And
say.
so, like,
I do think that-
I understand the distinction. I guess I just don't agree with.
Well, maybe this needs to be tweaked as well, just to ensure that we're not confusing a reader who might not understand the architectural distinction versus the historical designation distinction.
And the whole property is historic.
Right.
Whether you think it is, I mean, it's been designated as historic. And, maybe some buildings are more historic than others, but it isn't a standalone historic structure. And maybe you could say what you just said. Maybe it could be reworded to say it's architecturally significant or it's or something.
And part of the reason for that wording was to distinguish it from the Anderson House, meaning that even if the Anderson House goes away, the Hopkins House can stand alone as a historic structure in its own right as a structure in a way that the Anderson House could not. But we will
Yeah, I wouldn't want to give anybody
Sure
the
that folks don't
impression,
get the wrong impression.
the entire property is historic. And I think that is important. I mean, it's mentioned in the first paragraph in the entire property is historic and every building on it is historic.
Well, two of them aren't.
Well, I mean, it's in the designation. Well, the one, right, not the garage. And, okay, you're right, not
I
every
think,
property.
and I think
but
you probably
yes.
can make a change, but again, it does say it's a historic feature of the site. It doesn't say it is the only historic thing on the site.
No, but again,
I mean, it's
yeah.
just drafting, but I mean, like I said, and maybe I've been so deep in it, I mean, I felt like, I mean, Emily worked really hard to get language that sort of encompassed what everybody's views are, and,
I guess what I'm objecting to is that if we tore down everything else, it would potentially lose its historic designation and we'd have to go get a new one. I mean, it's not a standalone. It isn't.
I understand.
It isn't by itself,
I get it. I mean,
right?
I think
And,
there's I think there's a word swap we could do fairly
Yes.
easily that would accomplish both goals.
And then I guess before we move forward, I get to Councilor Heller's point, I will just renew after offering that feedback that I don't support the vision at all. But I do appreciate the vast amount of work that went into it. So that being said, if there's no further comment, I would entertain a motion.
well, I move to.
Before we make a motion.
Go ahead.
So we do have a recommendation for 3 recommended changes. I would recommend that if a council member wants to see those incorporated, that you include those in the motion. And then that would allow us to work on those.
You mean the actual specifics?
Well, I don't know if we need to necessarily wordsmith it within the motion, but give.
I was going to make the motion including the 3.
Oh, you're way ahead of me. Sorry, Mayor Pro Tem.
But it wasn't going to be any broader than those 3 suggestions that were discussed.
Great.
That's why I'm going to pass the motion. Okay. Okay, I move to approve the vision for Quincy Farm, including the 3 recommendations that were discussed and agreed to this evening.
Second.
It's been moved and seconded. All in favor?
One
Oh,
comment.
wait, question, sorry. Counselor Heller.
I just again want to say that it's subject to getting the definitions later on small, medium, private event, and commercial use. I think those are the 4 at least that were on my list.
But so are you?
It's not part of the motion, no.
Oh, okay.
Yep.
Okay, just comment. Okay. Okay, all in favor?
Aye.
Any opposed?
Yes.
Oh, there's one opposed.
No.
Oh, you're an aye. Okay, sorry, I went too fast. Sorry, Doug.
Doug, you are supporting it or no?
Doug.
Doug?
I was a yes.
Yes,
Okay.
okay.
Yes.
All right, that passes unanimously. All right. And then moving on to reports. I don't think I have anything to report at this time, but I do just remember that we don't have a meeting the first week in July, so our next meeting is not until the 3rd week of July. And we'll start down here. Counselor Fisher.
No report, thanks.
Counselor Robinson.
I just have a brief report. Just wanted you to know where your money is going through the Arapahoe County Opioid Abatement Council, and I'll be very brief with this. But on the prevention side, there are 3 groups: Amali, One Chance to Grow Up, and the Cherry Creek Leadership Academy, which has 76 students from schools across the district, elementary, and I'm not elementary, but middle school and high school. Prevention work is going on there. Then on the treatment side, money is going to the Arapahoe County Sheriff's Office, specifically for treatment within the jail. And there's drugs and therapy, virtual peer support, and other programs have impacted 516 incarcerated individuals so far this year. Also on the treatment side, Signal Behavioral Health is a workforce development program 74 individuals have been funded to be able to become therapists. There a lack of trained therapists is a big problem in the space. In the substance abuse area, that's going towards that. And then on the harm reduction, Arapahoe Public Health is receiving money for naloxone kits and other harm reduction approaches. And then on the recovery side, 3 organizations, Hazelbrook, Hornbuckle, and Tribe, are collectively housing about 500 people in some sort of recovery living environment, mostly sober living. So anyways, I just wanted you to know that there is a lot of activity and good work being done to spend millions of dollars that is provided as part of the opioid settlement in Arapahoe County.
Great, thank you. Counselor McGuire. Counselor Holland.
No report. I just want to thank Kelly for the audit. It was a great job. And I just wanted to say that I've been working with finance directors here since 2014. Cherry Hills has continued to improve itself from a financial reporting perspective every single year, as well as its overall financial performance. And I think staff needs to be commended on doing that, not only in terms of the reporting, which is great for council as well as our citizens if they want to look, but as well as the management of our finances and the implementation by all of staff, which is just terrific. So I just wanted to pass that on.
Thank you. Counselor Eber.
A couple small things. This morning, Denise, Chris, and I attended the State of Arapahoe County breakfast. It was entitled about making good. And so they went through a number of different areas where Arapahoe County has tried to make good and is doing good things throughout the county. One of the things that they emphasized was partnerships and the importance of all the different levels of partnerships. So I thought it was an interesting program. I went through the different numbers of housing starts, for instance, a lot of different areas where they are working hard to deliver on their job as a county. So it was good in that respect. Secondly, Bike to Work Day is tomorrow. I think that, not tomorrow, 2 days, next week.
Next Wednesday.
Next Wednesday, sorry. And we will have a station.
We will. We'll have bagels, coffee, water. Folks should stop by anytime from 7:30 to 9:30.
And so if any of us can help welcome people, that would be wonderful. I wanted to give a quick thanks also to all the folks at Public Works for the hot pavement job that seems to be winding down. I had one very long delay on Colorado Boulevard last week, but it really overall has gone in great. But I thought it was a really well done project. So thank you for that. I also wanted to encourage and give thanks to the folks again in the Parks program for all the good work on city properties right now. While water, it may be early, but everything looks great for right now, and I give you encouragement and good lucks for what comes as we continue to be dry through the hotter parts of the summer. Finally, I just wanted to say happy 4th of July to everybody and happy birthday to America. Make it a great 250th, and our job is to have healthy, safe celebrations as we go forward into the next year. So thank you very much.
Thank you. Counselor Heller.
Yeah, just a couple of quick items. First, I wanted to really take a moment to thank everyone, particularly the Land Preserve, Emily Earl as our representative for the Quincy Farm resolution. 3 of us have not been here for the bulk of the discussions, but apparently it's gone on for a long time. It is sort of the jewel of Cherry Hills Village. I think it's just great that we got where we did. There are disagreements, but we're moving forward. So just wanted to thank everybody, but especially those key stakeholders. Second, on the airport roundtable, just a leadership change. The chair of the roundtable has resigned, not from the roundtable, but as the chair. So the vice is moving up, and they're looking for Another, I'm not interested, but that's the only thing that's going on there. And then last, I don't know if everybody gets these emails. I asked the city manager about it, and he suggested I raise from the Denver Chamber on the State of the Cities session. It's coming up July 29th. So it sounds like everybody does get it, but they're looking for electeds to serve as kind of table captains. If you don't have the email, happy to forward it, but that's it.
The underlying tone is that there will be discussions regarding housing legislation. So I don't know what they want to do with those conversations, but that if that all has any kind of momentum that gets used with the legislature or whoever, we're not members of the Denver Chamber.
Yeah.
So.
And the Denver Chamber is supportive of all of that.
Agreed. And so if we want a opposing voice to be heard, this would be unusual for us to participate in a Denver Chamber event.
I think you're being asked to moderate tables,
If
not
you're
be a
table-
speaker.
Right, if you're a table captain, you're taking notes.
Yeah.
I think you could I would still moderate with there's a way to get it in there.
Moderate.
Yeah. Oh, that's interesting. In an effort to further the discussion, I'd like to bring up a potential countering idea, see if that generates more dialogue. Anyway, my point is, it may not be the worst idea for us to take the unusual step of maybe having at least one person there.
Yeah.
Just a thought.
Okay. And then I guess it's you anyway.
Yeah, I don't have a ton, so before I kick it off to everybody else, I do want to say, great job. I know everybody has different levels of acceptance of where we're at with the Quincy Farm Vision. I'm not here to make a comment on that. I just want to comment on getting to where we've got procedurally. It has been so long. And I will tell you, there were many moments just in this one process over the last number of months where I personally was a little iffy of whether we're going to get across this finish line. There are many more finish lines to come. And so I do want to thank a lot of people, Earl, the Land Preserve, especially I do want to thank Emily. Staff doesn't usually go out for post-council happy hours. I've been at many cities that do. If we ever were going to do it, this would have been the night. Also, I do want to say, happy 4th of July, 250th, 150th for Colorado. Because we won't see each other again until, for our official council meeting, until after that occurs, so.
We are moving forward with the court collection process and have received 5 qualified quotes that we're starting to go through now. And I'm just looking to see if any council member would like to be a part of those interview and selection process. You don't have to tell me tonight, but if it's something you are interested in sitting in on and helping select our first collections vendor, please let me know. And that's it. Happy 4th of July.
Thank you.
Thank you all for getting us across the finish line. And yes, thank you, Earl, for all of your extra time on the Quincy Farm team. And of course, to CHLP, our wonderful partners. We would not be here without you. For Bike to Work Day, if the purpose of Bike to Work Day is really to replace a car trip, it does not have to be to work. So if you work from home, if you're retired, CHLP is having a bike-in movie at Quincy Farm that night. They're showing The Biggest Little Farm, I think is the movie. So you can sign up on their website, and that's a great way to participate in Bike to Work Day too, or support the Land Preserve at the same time. Before our next council meeting on July 21st, we're going to reschedule our pond ribbon cutting to that evening. So I will send you all out a new invite. That's all I have.
Councilor Ebert stole a few of my things. I was going to mention, some of our grass is taking really well. The park staff is doing a phenomenal job in keeping under those water budgets and the water times. You will see, and I hadn't been out there for a while, some of our bluegrass has already started to really show the issues. So if you hear complaints, let us know, but we are sticking to those restrictions on every one of our sites. And again, like here at the city center, especially on the north side where it's a little shaded and The grass is doing well behind the pavilion and the park restrooms because it's in full sun. It looks like a bomb went off, and we know that's happening, but again, I think everyone understands why some of those things are happening. And the park staff is continuing to try to tweak things and see if, some revive here, and but we do want to stay with those water restrictions. I want to give a shout out to Ryan Bernanzoni and the streets crew. They are the real reason that they kept our contractors moving along, kept on top of them. I even talked to our contractor today, and they really were thankful. They said, tell Ryan thanks, because we don't get enough leadership like that in other cities and everything. It's just, they kind of go at their own pace, and we don't allow that with any of our contractors, and it was nice to hear a contractor, really appreciate how well-run our streets department is. We're working on the parks crew is working on the footbridge. When we were looking at putting that project together, they came forward and asked if they could build it. I did take it out to bid to see what the construction would cost. The lowest bid we got was $25,000 just to put the bridge together. So as soon as they're done, and I know all of their hours, I will report back to council, but I'm guessing probably a $10,000 to $15,000 savings even after we pay our staff. So that's phenomenal. That's all I have.
Tell them much appreciated.
Yes. I feel like I should stand.
You look like Bob Barker now with your.
Sorry, I could. I know, I've already committed. Thank you though, Emily. I just wanted to respond to a question that came up last council meeting. I wasn't here, regarding our insurance limits and agreements. Laura and I did a deep dive, city clerk and I did a deep dive on the other side of insurance and property casualty as it pertains to our agreements. We did identify a change for our template to add cybersecurity into the template so that the vendor, the entity, whoever we are looking to work with, drums up a conversation to tell us why they think it doesn't apply and it should be removed. Now that cyber's become such a mainstream, it applies to most things that we're doing. But with regard to the limits, we do review the limits depending on the project, depending on the scope and the risk. There is a project that Director Goldie's working on that he asked me to send to CIRSA, and they did, in fact, recommend that we up those limits. So it's really going to be dependent upon the agreement, what we're doing, what work we're looking to have.
I think I asked that question, so thank
Yes, you did. That's why I thought I should just stand so that I can. Thank you. Yes, thank you.
Yes.
I won't stand. I'll just say nothing yet. Nothing.
Good evening. For the August 18th council meeting, I believe Councilor Eber is out and Councilor Fisher is out, might be able to join remotely, but to be determined. And I just want to make sure that the others will be here in person, so we have our quorum.
Sorry, what date?
August 18th, the second meeting in August.
Doug's a yes.
Okay. Earl's still looking.
I'm here as far as I know. That's within a week of my 30th wedding anniversary. My wife tells me that we're going to be doing something, but nothing's been planned. So as far as I know, I'll be here, but I reserve the right to.
Can you ever reach out to us?
And they said it couldn't be done.
Yeah. Okay.
Thank you.
And I just broke this earlier. And I will see you all on July 21st, so have a great 4th of July.
Great, thank you. All right, well, if there's nothing else, we will stand adjourned at 8:34 p.m. Sorry, Denise, this whole meeting, I didn't know you were over there. When I looked, I was like, wait, I see a head.